निर्बभूव कलशं ददर्न वाद्य पीयूषपूर्ण ममरात्वकृते सुराणां रोज्जालजीर्ण जनता जनित प्रशंसो धन्वन्तरिच भगवान् भविकाय भूयात्। श्री धन्वंतराय नमः। ओम शांति, ओम शांति, ओम शांति। Welcome. We would like to welcome you all on Ayush Samriddhi's 384th journey today on what? Telangana Foundation Day. We would like to learn about Telangana Foundation Day also, as well as what is the status of Ayurveda in Telangana and what is the status of Guru Parampara, Vaidya Parampara and Maharshi Parampara, whether there are some gharanas are established and existent at present also, and what is the actual system of Telangana system of treatment, because Jagadishwar ji every time reminding some new books which we have not read. So definitely your Telangana Sahitya culture is enriched with Ayurvedic Maharshis. So I would like to welcome again Professor Madan Thangvelu sir, respected Chandrabhushan Jaji sir from BHU, from Dr. Professor N. Sridhar, Dr. Jagadishwar ji, Sri Vaidya V.K. Agnihotri ji, Professor V.K. Agnihotri ji, Vaidya Jayesh Thakkar ji. I am really overwhelmed that we are here again on 384th step of our journey. This is only the milestone, not the destination. So thank you very much. For welcome address today, Vishnu Prasad Sharma ji has not joined. I would like to request Professor V.K. Agnihotri ji for welcome address, and then as inauguration, as senior dignitary like C.V. Jhaji is with us, few blessings we will take from Adharaniya C.V. Jhaji, and as usual, our guide, Professor Madan Thangvelu sir, will moderate the session and we will learn from all the speakers. This is our aim. Thank you. So Professor V.K. Agnihotri sir, welcome sir.
Thank you sir. Thank you Dr. Pawan Sharma ji. Namaskar. It's our great privilege. I am seeing that is it any difference in counting? It is 385, 85th I think.
Sorry, missed. Sorry, 385. Sorry.
You told 2 times. I have to search back. I am also a great observer, thinking this that how it is happening. How can I go back? Anyway, so thank you so much. Today again a great day, and its greatness from so many angles. As our country India got one more state today named as Telangana, which is been separated from existing state Andhra Pradesh. So Andhra and Telangana, though it was having the same Hyderabad capital, so in that way, in the history of Indian geography and politics, both Telangana got a new, India got a new state like Telangana. I was just searching today morning regarding the establishment of and development of Telangana. I found that it is developing like anything. The greenery is being decided as the greatest greenery of world. This Telangana, probably Dr. Jagadishwar Doma definitely will throw lights over this point. And again, 44 plus crore trees are planted during these years after the establishment of Telangana states. It's the greatest number. So greenery is now top world as far as the Telangana is concerned. So goes the case with the material, the waste product consumption and its final disposal. This is a great achievement of Telangana state itself. So with these important features, we are most eager to listen what Telangana is known for. And our greatest pleasure is that this interest has been also be shared by our Guruji, Professor C.V. Jha sir. So right from Professor C.V. Jha sir, our Professor Madan Sarji, and our Dr. Pawan Sharma ji, Vaidya Thakkar ji, along with Professor Vishubha Sharma ji is also joined. We are all paying full regards to them, along with our great speakers, starting from Professor D.N. Sridhar and Dr. Professor Saileshnath Saxena, along with our well-beloved and most respected Dr. Jagadishwar Doma ji, because his presence has always been given a great instructions, light and direction to us all. And today he himself is presenting his whole journey of update knowledge. So we are all great and be pleased. Not only this, we are now facing him on video also. So it's our achievement. So these days, so many angles is very important. It became important. So with all these remarks, I welcome all to today's platform on our 385th step of our great journey. So we again and again welcome, and we are most eager to listen the great distinguished our guest speakers with their inputs and their knowledge. Thank you, sir. Over to Dr. Pawan Sharma ji.
Thank you, sir. Thank you very much. Now, respected Vishnu Prasad Sharma ji is also joined. Welcome, sir. Your initial blessing, sir.
Okay. Thank you. Namaskar to everybody. Respected Professor Madan Thangavalaji, respected Professor V.K. Agnihotriji, Professor C.V. Jha, Dr. Pawan Kumar Sharma ji, distinguished guests, eminent speaker, ladies and gentlemen. Today's seminar on Telangana Parampara. It is an interesting subject, interesting matter. So I welcome all the eminent speakers to this webinar, and including all the distinguished guests, ladies and gentlemen, to this webinar. Namaskar. Thank you to all.
Thank you very much, sir.
Sorry for running late because I am at Delhi. Network.
Welcome.
I'm at Delhi.
So I welcome Somani ji, I welcome Sudhakar Reddy ji, and I would like to invite C.V. Jha ji, sir.
Namaskar, namaskar.
Initial blessing, sir.
Namaskar.
You are mute, sir.
नमस्कार
नमस्कार सर.
मेरी आवाज आ रही है?
बिल्कुल आ रही है सर. स्वागतम.
सबसे पहले मैं सब लोगों को प्रणाम करता हूं और 385वें एपिसोड के लिए हमारे परमप्रिय मित्र कहें पवन जी को हार्दिक बधाई देता हूं और खास करके आज तेलंगाना दिवस के अवसर पर समस्त तेलंगाना क्षेत्र से जुड़े हुए हमारे जितने भी आयुर्वेद के विद्वान लोग इस कार्यक्रम से जुड़े हैं, सबको मेरी ओर से शुभकामना। और जैसा कि आज का विषय है तेलंगाना की परंपरा, आयुर्वेद का अपना जो कुछ भी एक मूल रूप है, जो वेदों से प्रारंभ हो करके संहिताओं और फिर आगे चल करके संग्रह काल में जो कुछ भी है, इन सब के शास्त्र के अतिरिक्त हर क्षेत्र की अपनी एक कुछ विशेषता रही है। और चाहे वो कोई भी राज्य हो, कोई भी स्टेट हो, कुछ न कुछ एक विशेषता के साथ हर क्षेत्र में देखा जाता है। और इस विषय पर कई ऐसे एपिसोड हो भी चुके हैं जिसमें राजस्थान के, बंगाल के और महाराष्ट्र के। तो इसी क्रम में आज हम सभी तेलंगाना के तेलंगाना क्षेत्र में आयुर्वेद का क्या स्वरूप रहा है, अच्छे अच्छे कौन लोग इसमें प्रैक्टिशनर्स रहे हैं, इन सब के बारे में हम सबको सुनने को मिलेगा। जहाँ तक मेरे ज्ञान में है, एक सबसे प्रसिद्ध जो कहा जाता है कि हैदराबाद निजाम के चिकित्सक हुआ करते थे पंडित तारनाथ जी, और बड़े पहुंचे हुए सिद्ध पुरुष थे। और उन्होंने एक जो कुछ भी चिकित्सा के क्षेत्र में उनकी उपलब्धि थी वो तो थी, और साथ साथ योग साधना से लेकर के और एक सिद्ध पुरुष के रूप में थे। और किसी कारण से वो वहाँ से बेल्लारी शिफ्ट हुए, और बेल्लारी में उन्होंने संस्था स्थापित की जो आगे चल करके तारनाथ आयुर्वेद महाविद्यालय के रूप में आज के समय में कार्यरत है और शिक्षा के क्षेत्र में बढ़िया योगदान कर रहा है। तो मैं और अधिक इस संबंध में ना, जो भी हमारे तेलंगाना क्षेत्र से वक्ता सब जुड़े हुए हैं उनको हम सुनेंगे। मैं इन्हीं शब्दों के साथ अपनी शुभकामना व्यक्त करता हूं और आगे के कार्यक्रम के लिए आग्रह करता हूं। धन्यवाद।
बहुत आभार, बहुत बहुत धन्यवाद सर। Now I would like to request Professor Madan Thangvelu sir. Kindly sir, stage is yours now.
Pavanji, pranam.
Pranam sir, pranam sir.
Pranams to Domaji. Domaji, you are, as Agnihotriji said, every event we are looking forward to a brief message from you, which always adds so much extra value to our discussions. और आज जहाँ साहब से भी प्रणाम लेता हूँ। जहाँ साहब नमस्कार जी, प्रणाम जी।
नमस्कार नमस्कार नमस्कार।
बहुत बहुत धन्यवाद जी for being with us, आज हमारे साथ जुड़ने के लिए बहुत बहुत धन्यवाद। This event, of course, is a very special day to see the big state of Hyderabad, the big state of Andhra Pradesh, which was earlier an even bigger state of Hyderabad. And the two Hyderabad's, one Hyderabad which is left, which is further north in the west, and the Hyderabad that we have today. When we look at the history of these states, the history is a very deep one.
Telangana,
and particularly from the Buddhist tradition. And Nagarjuna and the connections with Nagarjuna, that the second Buddha, and the stupas of Andhra Pradesh and what is there in Telangana now are all very historic. And it has given Andhra Pradesh, the old Andhra Pradesh, and whatever we have today as the two states, Telangana and Andhra Pradesh, a very special position in the history of Ayurveda. And within that, particularly in the area of Rasa Shastra. And Domaji was very right in mentioning in one of our earlier programs about the Andhra Vaishajya Ratnavali. And I think Pavanji was very right in saying at that point, आज तक सुना नहीं, पहली बार सुन रहा हूँ। हम तो पावन जी की उस दिन जो कमेंट था कि हम तो है रसशास्त्र के आदमी, और आज सुन रहा हूँ पहली बार कि आंध्रा वैशाज्य रत्नावली क्या चीज है. So this was a very important thing, and similarly there are many other documents and many other standards in the Rashastra domain that have been set up by people in that part of the world, and it is a reflection of the history of how the science has developed there. Now, I do not read Telugu, but here it is. Here is the front page of Vaishajya, Andhra Vaishajya Ratnavali. There will be many such documents there available in archives. This document is 100 pages, and it comes from, I think, somewhere in Ratnapuri, Amalapuram in East Godavari. That history of that part of the land has taken us into so many aspects for the connection with British. The example I always give is of Arthur Cotton and the Godavari Anikats. which has Arthur Cotton was a very special man, and he's still deeply remembered and respected in Andhra Pradesh and around the Godavari area. How he could convert, using one anicut, he could convert many thousands and thousands of hectares of land into cultivable paddy production. So this is that long continuity that we have in Andhra Pradesh. The Government Ayurveda College in Hyderabad is a center of excellence of many kinds for clinical expertise, teaching, etc. So we are delighted to have with us colleagues. Domaji has brought from Telangana, the Telugu-speaking part of the world. We look forward to learning a little more about all that you have to offer us today, and I hope as the discussions go, we will learn a little more about the deep cultural roots of how certain aspects of Ayurveda took deep root in that part of the world. So with those few words, I am particularly interested in the deep history of the culture, the Buddhist connections in that part of the world, and all that came afterwards, and the scholarship that it provided for many areas in Ayurveda. So I leave it to Domaji to take us into this world, but leave it with Pavanji to take us into the program. Pavanji, pranam, namaskar.
Namaskar, namaskar. Now I am requesting Professor Dr. N. Sridhar, Professor and HOD, Department of PG Shalyatantra, Dr. BRKR Government Ayurvedic College, Hyderabad. Dr. Sridhar has initiated a nice movement, Dhanvantari Anugrah. Really great concept. Everybody is posting their photo and video of Dhanvantari Pujan every day. So this is also a nice moment to incline to motivate the person toward Dhanvantari Pujan. Great, Dr. Sridhar, great. Excellent. Now we would like to listen from you about Telangana.
Sridharji, before you start, I just want to make one comment here that we have had in CCRAS important people from Andhra Pradesh, Ramesh Babu, Devala, and so many other people are there who have enriched our contemporary Ayurveda research and aspects. So we look forward to learning more. Welcome to the platform. Thank you so much for joining us today. Namaskar ji. Please, you are muted. Please unmute.
Yeah.
Sudhakar Reddy ji, pranam.
Sir, pranam sir.
Namaskar.
Pranam sir, sabko.
Om Shri Dhanvantaraye Namaha. Hope I am audible to all of you.
Sridharji, you could be a little louder. We can hear you, but we have to strain a little bit. Thoda sa.
Now, sir.
Much better, much better. Thank you so much.
Yeah, very good evening, one and all. Respected Agnihotri ji.
It will be more convenient if you could put your microphone closer to your shirt. Maybe just put it inside the collar there, and then we will be able to hear. Might be easier for you too.
Okay, I will be holding it closer to my mouth. Yeah. And today's event host and the convener, Pavanji, and different speakers from different corners, and the moderator from UK, Madanji, and all other participants. A very warm good evening to one and all. I would like to express my heartfelt congratulations and best wishes to all the Telangana people who fought for their state and succeeded on this day in 2014. A very happy Telangana State Formation Day to one and all. Well, actually, I am, as our Pavan sir was saying, that I belong to Shalyatantra. I'm a clinical subject person, particularly much interested on clinicals as well as in Ayurvedic surgery, more particularly. This is all historical and parampara. It's probably other speakers would be concentrating on that. But to the extent possible, I would like to focus on certain important points which are specific to Telangana, and they are doing some path-breaking activities. We all know, wherever this Ayurveda Vaidya Parampara comes, since Ayurveda belongs to or originated from India, the scenario across India is almost one and the same.
Sridharji, I'm going to interrupt you once again. Could you, maybe it will be convenient if you just push the microphone down your shirt into the collar there, and then it'll be closer to your throat. Otherwise, it'll be inconvenient for you, inconvenient for...
Is it okay now, please?
It could be better. If you, could be better. Could you put... Apologies for this, because the reason, Sridharji, the reason why I say this is our talks are recorded and archived so that people can visit again and listen to them. And we would like the highest quality where possible.
Yeah, maybe if I could able to hear.
Thank you. We will. We will.
Yeah, I believe that it's okay. So, as the topic today is the Vaidya Parampara, particularly in relation with Ayurveda, in Telangana is concerned. As I was saying, that Ayurveda belongs and originated from India primarily. And the knowledge is not related or relevant to particular one zone of any society or any life of any living beings, as it deals with the life science. So naturally the science is being propagated from one corner to another corner almost in a similar manner. So when the historical aspect of Telangana you look into the Ayurvedic subject, I feel do not much difference when relatively compared to other states. And we come across a lot of evidences. Most of you know probably more than me that there have been a lot of evidences in terms of Shilashasanas and all, and other excavatory activities, that there have been a lot of good knowledge of Ayurveda Vaidyas and establishments of hospitals, institutions that used to teach, propagate Ayurveda and ensuring the health, the good health for all people in different corners of Telangana. There are so many documentations. There have been a lot of what we call even seminars and all on this topic. There is a lot of information already gathered. So, Telangana formation is just quite little latest past. But when you look Ayurvedic profession flow, so all Andhra and Telangana comes together, in fact. So we don't find any much difference in that. There are so many people who had been practicing Ayurveda in a different style to its maximum extent, particularly when you look the quality of Ayurvedic practice in those days in relation with today's practice, either in Andhra or in Telangana or in any other areas of India even, we find a distinct difference. We find, when you go back to 17th, 18th century, even 19th century also you can take up, that there was no much influence of modern sciences, modern medical science and all. And what was existing was entire Ayurveda and its knowledge, and the people being educated about the health science and all. And people used to have at least a minimal to moderate health knowledge in every house and all. and all among even a common, at least a minimal educated people. They used to have adequate knowledge about simple diseases and their remedies and all. This is all we all know. We have been hearing from here and there in different contexts. There are so many, there are certain texts, as was saying, sir was quoting previously, even Madan sir was also quoting quite just now, that the Vaishya Ratnavali and all. The Basvarajaya is another text, Lolambar Rajiyam is another text that we have. And so many other texts we come across, like Nagarjuna, as you quoted. So there are different people working on different areas of the science and giving a quality service to the people, as well as a quality booster, a sort of thrust to the science to develop, to progress. And it was, totally an Ayurvedic atmosphere and Ayurvedic outlook. So, all concepts of Ayurveda used to be in practice. Contrary to today's scenario, we really do not find all the concepts of Ayurveda put in practice. We always, though maybe the best practitioner of today, we get a different scenario in their outlook. We always carry some modern science knowledge on our background and try to analyze our Ayurvedic concepts and the treatment modalities and try to put it in practice. This is the very distinct feature that we come across in today's scenario in Telangana, or in the bygone days scenario. So the people used to use the maximum, the skill of their proficiency, particularly using Nadi Pariksha. Nadi Pariksha used to be one of the very much pronounced practice in Telangana, Andhra. And even today, we find in certain corners of Hyderabad that there are practitioners who totally rely on Nadi Pariksha. People come, they come one day before, they take shelter in and around the hospital, and they go to the doctor early in the morning, because it is known that Nadi Pariksha should be done in early hours after settling down all mechanisms by sleeping and for adequate sleep and all. So this is all practice is being seen even today, not really to that extent, but still here and there we find. But in those days, the people used to use the entire concepts of Ayurveda. Like, for example, why I am repeating the concepts of Ayurveda is that there are certain important concepts which make us to put the Ayurvedic science into practice. For example, these Vyadhigatakas, there is one concept, Vyadhigatakas. There is one concept called Rogamargas. We have one concept called Sharupakramas. So these things are not being utilized clinically nowadays. We try to correlate them with that of the knowledge of modern science, whichever is proved like, which is said to be science like, which is said to be evidence based like. Then on that background knowledge, we try to analyze Ayurvedic statements and try to put it in practice wherever it is required. But in those days, in 18th century, 17th century, and before that also, we have the evidences that there were adequate medical facilities in Telangana and Andhra, where there used to be very good quality to hospitals of different specialities even. There used to be complete science used to be put it in practice. This is a very striking feature that I come across. I in Telangana and Andhra particularly, and I feel fascinated by that. And I feel that we all people, though we may be a good practitioner, roaring practitioner today, yet to learn that concept from those days. So there have been evidences that Nalgonda, in Suryapet and this and that areas where there used to be special hospitals like for Prasuti and all, labor and all. And there used to be veterinary hospitals even. There used to be very good, managed hospitals, with a lot of open land, plantations, a good ambience, and well, fresh air and all facilities, and good surgeons, a surgical room, surgical ward and all. All these evidences we get in what we call the archaeological excavations and all. So there, looking at all these aspects, like particularly the Siddhanagarjuna like people, they used to practice even the mantra shastra, Siddha yogas and all, where a little medicine used to be used for their maximum benefit, added with or synergetized by the mantras and all other things, which now we conspicuously feel it's missing in today's practice, not only in Telangana and Andhra and anywhere, even in India. So these are all certain things which makes Telangana a bit unique, or what we call very conspicuous in relation with the practice of Ayurveda. And there was one trend of practice is that doctors used to visit sick people home, and the doctors were given shelter, or they used to take their care, and they used to reside close to their patients home or whatever the place, and they used to treat for, usually we know that most of the practices, most of the medications, the maximum extent of medicine when we give continuously is said to be a mandala kala, and most of the time most of the diseases get adequate result in mandala kala. So the doctors used to be there in the vicinity of patient, and they used to take care of the patient in treating their diseases. And like patients used to honor doctors a lot. And this is another trend that we see in Telangana area practices by doctors and all. And we also see that the doctors used to, after a certain period, like when this sort of practice is diluted because of so many reasons and all, they slowly, these doctors have become less in, quality of knowledge, and slowly they diluted, and they started, roaming from home to home, where we today even see on the roadside of Telangana or in other Hyderabad capital cities like cities also, that they simply give some medications for certain reasons without any background knowledge and all. This is how it slowly diluted, and the proficiency of Ayurvedic practice, which was fully bloomed in 18th century, 17th century, before that even till 19th century, early centuries, that slowly vanished. And now what we see in today's Ayurvedic practice in Telangana is, like say mixopathy, like we say. In fact, most of the doctors, they practice less pure Ayurvedic practice, and they give less importance to the concept. They go by disease oriented treatments rather than the conceptual oriented treatments of any disease. And like whatever we come across in samhitas or any other texts, whatever the remedies or the procedures, for example, as I said, I'm a surgeon, we come across different surgical procedures as if done in Samhita, Samhita, lot of surgeries, cataract surgeries, intestinal resections and laparotomies, like all surgeries have been very much documented in Samhitas. Now this has all become like a story, like it's not being put in practice because the overall outlook of Ayurvedic doctors towards the science and their practices reduced, and their confidence reduced, and altogether people have made Ayurveda as an historical event rather than a practical possibility. But however, when you look back for the last 20, 25 years or more than that a bit, that now the younger generation, because of the elderly people who inspired the people and all, they started practicing Ayurveda, and they are coming up with a lot of pure Ayurvedic hospitals, establishing hospitals in all centers. They are doing a lot of panchakarmas and all surgical procedures. For example, I myself, I'm a HOD in the Department of PG Studies in Shalyatantra from Dr. B.R. Kerr Government Ayurvedic College, Hyderabad, which is one of the oldest college of Telangana. I started doing practice of surgery. I do all surface surgeries without using any modern medication. So I do all surgeries post-operatively. I manage only with Ayurvedic drugs. I do all surface surgeries. Even I have started even plastic surgery. Last year, I organized even a national Ayurvedic plastic surgery conference for 2 days in July 14th and 15th. Which was 15th is the International Plastic Surgery Day. So for the first time in the history, I believe in Ayurveda, I organized a national webinar, a conference on this, and I invited a lot of Ayurvedic surgeons, even along with modern plastic surgeons also, where I presented, demonstrated a plastic surgery, particularly a skin grafting, which I took a flap from thigh to, and I placed it on the foot where the patient was suffering for the last 10 years with Dushtavrana, diabetic ulcer, where there was the ulcer was, Dushtavrana has become a what we call the a vrana which is ready to heal, but there was a lot of gap in the skin. Therefore, I thought of doing this, and I successfully did that without using any antibiotic or any such things. So what I was trying to tell is that apart from the general geographical, historical aspects of Telangana, how this has come and this, that and this, the Ayurvedic practice in Ayurveda had been very much flourished in those days. And there were people who worked for the system, and there was a lot of enthusiastic environment in those days, though the doctors were little, but the practice, the doctors used to put it in the society was very much appreciable, and people used to have a lot of confidence on the system, and they used to believe, and they used to be rest assured on the doctor, and they used to follow whatever the doctors used to say. And there were no problem like for Ayurvedic practitioner to put the science into society. But now the scenario has changed now because of the this modern science and much support to the modern science and less support to the Ayurveda, or less efforts by Ayurvedic professionals in doing Ayurvedic practice. So that slowly thinned out, and what we today in younger generations in Telangana colleges or anywhere in Telangana hospitals or Andhra hospitals, like in any other state of our country, we find less confidence in Ayurvedic doctors and less practitioners we see who practices Ayurveda pure. And we find a very, very meager number of people who try to put their efforts to come up with new thoughts, a better understanding of concepts, so that we bring the science, the greatness of science back to our today's society, and prove that Ayurveda is really a professional science, not a traditional science. Usually, most of Ayurvedic fraternity themselves, they name Ayurveda as a traditional medicine, which is, I feel, very, very wrong word that we use. It is not a traditional medicine. It's a professional medicine. It has got all the logical aspects. It has got all the bricks, the fundamental bricks on which you can build any new science, any new dimension to it. You can add anything to the new science, that we can use the science to the maximum extent, bringing the science to meet any emergencies even. This point also I would like to talk about here is that we often feel that the Ayurveda is lacking in emergency medication, but I feel it's not like that. We are lacking in rapid activity. We are lacking that. We do not move ourselves. We do not calculate clinical situation. We do not come up with a meaningful dialogue out of the clinical picture in a particular context of a patient, so that we plan a rapid and best procedure to save the patient of the life. This we are lacking. Therefore, we feel that we are lacking in proper medication to meet the emergency and all. So what I was trying to tell in this context is that as you know, that Ayurveda is highly potential science. What it requires is only our regeneration. We need to rejuvenate ourselves, our knowledge, work into the concepts of Ayurveda, try to put them in practice, and come up with a very decent and a very highly dignified professional practice in the society, which is quite possible if we put our efforts, if we particularly inspire our youngsters who got highly talented brain, who are really wonderful, like they are very much eager if somebody is making them to show some good path. So as you know, that the documentation of Ayurveda, the science in the form of Samhita is very complex. It is very condensed manner. It is very difficult, even the highly IQ person. So I thinking this, I actually had come up with one concept called Dhanvantariyam, under which one concept was Nitya Dhanvantari Namana, which our Pavan sir was saying, that the science of Ayurveda alone has got a spiritual highest authority, namely Dhanvantari, Sri Bhagavan Dhanvantari. So I thought to create a culture among our professionals that let us take help of Dhanvantari in understanding this complex science, because we are short of gurus. Even today we are short of gurus. Gurus are also having lot of queries which are not addressed properly. So to overcome this point, I was saying that let us say thank to Dhanvantari every day, if possible offering a garland of 50, 100 rupees something, and say that please help us in getting into the deeper layers of science, so that we put it in practice and we bring back the golden era of Ayurveda into this today's scenario. So this was all which is exclusive sort of activities which I wanted to focus on this in this context. Rest of the things probably our Jagadishwar sir and other would be focusing on it. I think I consumed my given time. I hope that some of these points would be helpful to the participants. I thank everyone, the organizer and all the dignitaries here, Madan sir, etc. Thank you so much for giving me this opportunity.
Sridharji, thank you so much for this wonderful introduction. You have touched on some fascinating points, and we could sense your passion for wanting to revive the strength of this traditional science, your experiences with Shushruth Samhita and the knowledge that is there for management of non-healing wounds, etc. And we would like to learn much more about this. I don't know if you are aware, in Bangalore at the Transdisciplinary University and the hospital there is a lot of work going on non-healing wounds and experiences similar to yours. I think if we come together, we will have a chat. Please share your contact details on the chat box so that we can, those here today can connect with you and learn a little more. And I would also like to introduce you to the team in Institute for Ayurveda and Integrative Medicine, the 100-bed hospital in Yelahanka in Bangalore. And maybe we can come together. We've had one meeting before with our colleagues in Austria who are also interested in learning about what is there, the different karmas that are there for preparing wounds, healing wounds, and speeding surgical procedures. So we would like to learn more. Please do share your contact details. The other very interesting, I'm taking a little bit of time here. What you've said is a very important point, that it's a professional science, not a traditional science. And there are many aspects of Ayurveda that needs to be viewed slightly differently. I'm happy that we have with us from Gwalior, Professor Sharma here with us. Sharmaji, namaskar.
Sir, namaskar, sir.
Pranamji. Thank you for being with us today. And we are very happy you are also here with us today, that we can, please stay with us so that we come up to the discussion section where all these points will come up. A question from me, Sridharji, don't answer it now, but keep it for the very end. If you had to connect with this new initiative coming up in Jamnagar, which is the WHO Global Center for Traditional Medicine, we would like to hear from you in the discussion section a few points of how you would inspire them to think a little bit about the contributions that can be had from Telangana and Andhra Pradesh in giving some new direction for that activity in Jamnagar. So I leave that question with you. We will take it up when we come to the discussion section. Before you leave, I put one word here, which I hear again and again, Ayurveda Shiksha. Shiksha is a very important word, that it is an indication not only of study, but very rigorous study. Shiksha is almost like deep study tending towards a punishment. That is what we need in Ayurveda today. If we have to get Ayurveda to the level where the world starts to respect it, I'm afraid we have to look at the word Shiksha instead of Parai. Shiksha is what we need. And I hope we can arrive at that kind of intensity. And we have senior people, Sharmaji is here, Jasab is here with us, and they're all people who have experienced that. Agnihotriji will be able to tell us a little more about that aspect. So we leave it there for the moment, and Pavanji will take us to our next speaker. Pavanji, namaskar.
Namaskar, sir. Dr. Saileshnath Saxena is at present on Bagha border and observing retreat. So whenever he will be leaving that retreat, he will be with us, as he told me. So now I would like to request Dr. Jagadishwar ji, he can bless us on the point. And I would like to welcome Sudhakar Reddy ji. I would like to welcome Dr. C.P. Sharma ji, former Joint Director, Ayush, Government of MP. Welcome Jagadishwar ji, welcome.
दादाजी नमस्कार।
नमस्कार।
आपको आप सभी लोगों को मेरा विनम्र प्रणाम। आप लोगों को एक विचित्र दिखा दे रहा हूँ अभी कि जानते हो कि डॉक्टर सुधाकर रेड्डी, I used to call him as Sudhakar, not with Reddy, and he has taken birth in Devarkadra, which falls in Mahbubnagar district. I do not know what his Aadhaar card represents today, and he belongs to Telangana only. By birth, he belongs to Telangana only, who is working at JSS, Mysore.
Thank you for information. We will definitely invite Reddy Sahib after you, sir.
Now you will invite before me, prior to my initiative. I think that he might have hesitated because it is a village. Previously, Little Big has come, little township now, and he has taken birth. Actually, why I am reminding this thing, a birthplace should not be forgotten in the lifetime. And I have taken birth, a place away from Maktal, 12 kilometers away from Maktal, called Karni, the birthplace where I have gone after 50 years. When I saw the place where my mother has given me birth, it is in mud stage because it was not our own. That is why we left, but it has been thrown to the mud. Then I ran down my tears like anything. After 50 days, I entered to that village, living
Right,
after
sir.
living 50 years.
So
But even
definitely I
till
will
today,
invite
that
him
also I
after you, sir.
after
Please
that's why it will be better to invite Sudhakar before me.
Okay.
जननी
Advance.
जन्मभूमिश्च
Reddy ji,
स्वर्गादपि
namaskar.
गरीयसी। जननी जन्मभूमिश्च स्वर्गादपि गरीयसी। You pointed out
Agnihotri, on many occasions, I feel proud of you because you refer from so many ancient times and also from Ramayana and all these things and a traditional way. And now the traditional point of Sridhar's this discourse I am bringing out. Now what Jamnagar has been established as a traditional science, if the word Ayurveda is split into Ayuhu plus Veda. Veda means knowledge and Ayu means life or longevity, whatever it may be. It should be actually named as a life science or longevity science or Ayurveda as it is. But actually they have confined to a tradition of Bharat. Tradition, when it is being termed as tradition on world level, then it becomes confined so small. It becomes, if it is being called as a life science or natural science, it becomes a vast one. I do not know how they have termed and how they consoled to the name itself. Thank you. Please, Kalan.
I would like to request Dr. Sudhakar Reddy ji, Professor Sudhakar Reddy ji, to highlight.
Namaskar. Namaskar.
Namaskar, Doctor.
Am I audible?
Yes.
Sir. So many days over. Congratulations once again, sir, for Guinness World Record. And evening time, I could not able to find the time because of the college busy schedule. And today, I'm happy to hear that our Telangana Day. First of all, I wish all the Telangana people a great Telangana Day. And I belongs to local Pakka Telangana, that is Mahabubnagar, near to our Jagadishwar's house only. My native place is 22 kilometers away from Jagadishwar's house, that is Mahabubnagar district headquarters. Mine is a village. And I'm happy to share that I am the alumni of Dr. B.R. Care Government Ayurveda Medical Hyderabad from 1988 to 94. I'm the product of Government Ayurveda Medical College, Hyderabad. And also, I'm proud that I'm the, again, post-graduation from South India only, that to Kerala, Trivandrum. So, the development of Ayurveda in South India has a long history, we can say, because we had great scholars of Ayurveda, like Pandita Divi Gopalacharilu, Captain Sejamasamurti, Achanta Lakshmipati, and almost Sriparamurti. So there are so many luminaries of Ayurveda are there in Telangana and Andhra Pradesh also. And I would like to share few things, sir, because Telangana tradition, we studied in Hyderabad only, as Dr. Sridhar was telling regarding those days, people were having the mixopathy, like getting knowledge both Ayurveda and modern. That is true, because when we were studying Ayurveda in BAMS Hyderabad, we had teachers. They are the integrated teachers, because most of the 90% doctors were GCIM. They were having both knowledge, allopathic and Ayurveda. That way, they are teaching us both Ayurveda and modern in a balanced way. Not fully modern, not fully Ayurveda, but balanced way. Still, I remember there are some doctors, they have pure Ayurvedic knowledge, they taught us. One example, sir, in Ayurveda College, Hyderabad, in Hospital Charminar, they developed a technology called as Kukutanda Tvakseda for Adhita Vata, a beautiful treatment remedy found out by our own doctors in Hyderabad. That simple procedure for Adhita Vata, for Sveda purpose on the facial and face, they have developed a Kukutanda Tvakseda. In that, just taking one cotton cloth, and the cotton cloth, the egg omelette you have to prepare it, and that we have to make into pieces of that one, and squeezing the lemon and making the potali and applying over the affected area.
We have lost Pavanji. Shayad kat gaya.
Apart from their any treatment, when the patient comes to us in the early stages, and this Veda has worked a lot. It gives strength to the facial muscles so that they will get the relief. That's Kukutanda Tvakseda. And one more, I would like to say that the Kshara Sutra, which became famous from Hyderabad Charminar Hospital only, our Saileshnath doctor, he developed this in that one, and because he was a PG and PhD from Banaras, and he developed technology of the Kshara Sutra, it became very famous. And for Shalakya Tantra, we had a great professor, Sripati Rao sir, and also Prabhakaran sir. They contributed a lot for Shalakya Tantra and Prasus Tantra and Shalakya Tantra. So there was only few PGs were there. In that Prasus Tantra, Shalya, Shalakya combinedly 10 seats were there. So they were calling the combined PG. So they developed a lot for the patient care purpose. So these two incidents I learned from the Ayurveda College Hyderabad, the traditional of Telangana, we can say, the Kukutanda Tokseda and Kshara Sutra. And also the Matra Basti, there was some Prakash Chandra Pandey, Kai Chiksa teacher was there. He was always telling us, as already Ayurveda says that Basti is the Ardha Chikitsa. A lot of contribution they have done for the Basti purpose also they are given. And for literature improvement purpose, undivided Andhra Pradesh, we had a Ayurvedic improvement trust. In that, all the textbooks of Charaka, Susta, Vagbhata, and even Ayurveda Itihasa, account syllabus, Kai Chiksa, Prasantra, Shalashalaka, everything they started in English, Telugu. Because there in the 1980s, there was no English medium in the colleges. There is local languages. We had a Hindi medium and Telugu medium. So Telugu purpose, Hindi purpose, there was a lot of books were available. And for Telugu reading people, our Andhra Pradesh Ayurvedic Improvement Trust, they had a separate wing to publish the books on syllabus, CCM syllabus in Telugu language. Sir, Tangavil sir, I can say that there are beautiful books, sir. Now also I am referring Telugu books, and those who are not able to understand Telugu, I am making them to understand by reading myself. Because lot of contribution done by our teachers in the literature review purpose. Panchakarma, and the Kai Chiksa 4 papers, Madhavanidhana, Roganidhana, and Ayurveda Itihasa, sir. Ayurveda is a beautiful 2 books that they published. And all from the Telugu language only, beautiful books. Just now as I referred, because of our seminar, because we need to have some contribution. But it's also a beautiful, that means they contributed a lot to Ayurveda in the form of literary research. That is by making the textbook available. And regarding the tradition of Telangana, as we know, sir, frankly speaking, there are only 60% doctors previously were having a good knowledge of Ayurveda and pure Ayurveda practicing. And especially, it is a Rasa Shastra based, Rasa drugs, most of the time. This I understood after UG, I went to do PG in Trivandrum, where I learned that all 99% only herbal preparations, Kashaya, Asava, Arishta, Churnas. But what we learned in Hyderabad, it is a herbo-mineral medicines, more of herb mineral medicine. And our Rashastra department was so well furnished, and also they were having a good knowledge of Rashastra. I taught by Dr. Vasant sir and Badradev sir. Still I remember the practicals of Rashastra and the Rashastra tradition, how the Rasa drugs will be effective in chronic as well as acute disease also. So they are so well versed in the Rashastra also. Apart from Rashastra, Dravinasa was there, but more of the South India, especially Andhra Pradesh and Telangana, they are having more number of Rasa drugs in the practice. And we have Nuri Ramashastri on his name. We have Vijayawada College, Achanda Lakshmipati, the oldest doctor. On his name, we have Warangal Ayurveda College. And even though our Buri Ramakrishna, BRKR, Buri Ramakrishna Rao, he was not doctor, but he was a CM of our state. That's why they kept on his name. And now the Ayurveda hospital, comparatively, I finished in 1994. It was in Charminar Hospital. It's an excellent hospital where we have Unani, Ayurveda together. And in Unani, sir, we can't believe a doctor was Srinivas Rao. Dr. Srinivas was there. He was a postgraduate from the Banaras, Shalaki Tantra, specialist of eye. And he was treating all eye disorders, but unfortunately, he was posted in the Unani Hospital. And he was served in the Unani Hospital only. And by 8 o'clock, there will be very big queue in the Unani Hospital only because of the eye purpose, that Srinivas Rao. And we are also fortunate that we are having weekly 1 class of his class for Shalaki Tantra, eye disorders. That way we learn that Ayurveda on there. And most of the periods are in Telangana or Hyderabad. Now the scenario changed. A BMS doctor also is having a lot of confidence on Ayurveda. previously was not one. I frankly accept that it was only 60 to 70%, sir, not 100%. Now a BAMS graduate also getting awareness regarding Ayurveda, because in Ayurveda there are some centers like Kerala Ayurvedic centers they started. Then we realized, why can't we start a Ayurveda hospital? That way the younger generation now changed that their attitude. And even though I practiced in my native place for only 2 years, but I was passionate to teach, and my subject is Swasthavritta. I chosen as a academic career. That's why I moved to Karnataka. Now I am in Mysore, teaching as well as practicing Ayurveda. And now I can say thanks to my all gurus who taught Ayurveda with their experiences. I can say, sir, now, sir, I can, when I'm teaching, I came to know that the notes which has given by teachers, running notes, which helped a lot. Ayurvedic prescription, especially rasa drugs for each disease, Pandu, Jwara, every disease, we were just noting without our knowledge. But if I now see that notebooks, I have still, sir, with my notebooks are there, that 30 years ago, whatever they taught, that's Adita Vata, for everything, there is rasa drugs are available, sir. It's a very beautiful teachers, they taught us Ayurveda, and especially Dr. VVS Rama Shastri, Srinivasulu, and C.H. Shastri, and Damodar Reddy, and Vasant sir, Badradev sir, all I can remember because they taught a very nice Ayurvedic knowledge to us, sir, apart from their modern knowledge. And I hope Telangana Day, they're celebrating the youngsters of Ayurveda. We have to motivate them. Already Dr. Sridhar sir is there, and about present principal also, he knows very well about that one. They're bringing awareness among the Ayurvedic graduates. And truly speaking, sir, during 1980s, 1888, I joined in Ayurveda college in Hyderabad. To keep apron also, we were afraid, because what you are studying is BAMS. Those days, what is BA, what is MS, they don't know. That places, we made them to understand that there is a course of BAMS, Ayurveda, and there is Ayurveda, future is there. Okay, for every chronic disorder, there is Ayurvedic prescription, Ayurvedic treatment is available. That way we started making the people to understand. But now the appearing people, they have an idea about the IRES systems. That's why it is easy for a teacher to motivate the young budding doctors, especially in Hyderabad, to propagate Ayurveda, to get the Ayurvedic tradition, which are practiced by the oldest doctors, those who are contributed a lot in the form of literary research, in the form of clinical research, and etc. And one more, sir, the oldest clinical research center under CCRS also was in our hospital, Hyderabad hospital, especially Amla Pitta. For Amla Pitta, there was a center, CCRS center in Hyderabad, that we came to know later on, because somebody there coming to our hospital and getting treatment for Amla Pitta under one center. Some doctor was sitting. After my post-graduation, I came to know that there was a center under CCRS in the hospital, and excellent, sir. They were working a lot. Amla Pitta they were developed. And we had one Dr. I. Sanjeev Rao. He was a great scholar of Ayurveda. He's contributed a lot to Ayurveda in the development of literature study as well as the clinical study. And also Dr. I. Sanjeev Rao, he developed a tablet like Parikalpa for the what we can call, sir, that family planning purpose. Still, the drug name and composition is with me, but only drawback was that he has to take for 3 months daily the tablet, and it prevents 3 years what we can family planning. But only they find out that there are some side effects like getting heat in the body and getting loose motions or other some things. That's why the ladies, they have stopped the drug. But they have conducted research on that one. They kept a Parikalpa tablet developed by I. Sanjeev Rao at Hyderabad, sir. So there are a lot of contributions are there from the Ayurvedic doctors from the Hyderabad, sir. That I can say, but especially rasa drugs. And we got more Dabur, the Vaidyanath, everything, whatever the prescription is there, that's all taught by us only. And especially by Ratnavali and or by the Vastuguna Deepika. One Telugu book is there, sir. Vastuguna Deepika. In that Vastuguna Deepika, whatever, even your pillow you are using, pillow also they have given a name and also qualities. For everything, whatever you're using day-to-day practice, they kept under Vastuguna Deepika. It is Telugu book, like Basavarajiyam, Andhra Basavarajiyam, Vastuguna Deepika is there. And the Vastuguna Deepika to bring into English, now I am trying, sir. But one thing is that it is a colloquial language of the Telugu. There, the colloquial language of Telugu to Sanskrit, we need to understand first the drug names, the locally available drugs they mentioned. That name has to be converted to the Sanskrit. From Sanskrit, again, we have to go for the English meaning. But Telugu, I can understand, but translation is difficult. But now I wanted to translate that one, sir. A beautiful book, Vastu Guna Deepika. Vastu means a padartha or anything which are using daily, including everything, all the drugs they mentioned in colloquial language. And during Rajavamsha of Andhra Pradesh, especially, they have made it Vastu Guna Deepika. It's available, sir. Next seminar, I will show that book also. I'm in the clinic now, right now. That book I will show, sir. A beautiful book. If anybody, I think one more speaker is there. My senior, Dr. Nilesh, sorry, Saileshnath. Sailesh sir is there. He was my just 4 years senior to me. When I was studying first year BMS, he was in final year BMS. I think the speaker are yet to come. And Jagadish sir, I know very well since 1989, because my native place, whenever I was coming to Mahabubnagar, I visit to sir, and I learned so much from the sir because pure traditional Ayurveda practitioner. He never allow any allopathic prescription. Even he also against of Himalaya Trunk Company, because they'll extract the medicine that may not work properly. We need to go for only the classical preparation that Jagadishwar sir will believe. And he's not only just a doctor, sir, he is a philosopher. And he knows very well Jyotish Shastra, Ayurveda, and everything also. Okay. Whenever I reach there, I'll contact sir also. I was saying previously. Now I am rarely going to Mahabubnagar. That's why I would not able to meet sir also. And sir, with these remarks, thank you very much for giving this opportunity. Sharma sir, Agnivat sir, and Tangaveli sir, and Vishnu sir, Sharma sir. Thank you very much, sir. I hope I done justice to my stipulated time. Thank you very much, sir.
Sridhar, thank you so much for mentioning Vastuguna Deepika, and here it is on the screen.
Yes, sir. This is our latest edition. I have old edition. That wrapper is a different one. But anyway, this is the latest edition, sir. I have old edition. This is very excellent book, sir. Excellent book,
so
sir.
much.
Everything will get it in that one. All Ayurvedic like Vata Pitta Kapha, but colloquial language it is there. That colloquial language we have to translate into another language in English, sir. It's excellent book, sir. Thank you very much, sir. You have showed that book.
We are so lucky that you joined us today, and thanks to Domaji for giving a brief introduction to where you come from in Telangana. It's very, very important that we, this conversation today is very important. Number one, you have told us about this role of and the confidence with which Rasa Aushadhis are used in daily practice. And this is also a little bit in Maharashtra, but as you said correctly, when we come to the south, Karnataka, Kerala, Tamil Nadu, there is a little bit in Tamil Nadu, but not as much. And I think we can learn a lot from Andhra and the way it is used. Maybe there are still practitioners who have that confidence and have local formulations also. So thank you, Sridhar ji, for highlighting this point. I have also a question here. When you say Charminar Hospital, it is the same as the General Hospital in Charminar, which is that correct? Because
yes, sir. In Charminar, we have Ayurveda Hospital and Unani Hospital. Both are there. Government
okay,
hospital.
so two hospitals in Charminar.
Now it is shift. That's a teaching hospital of our college. College was in Eragadda, nearly 15 kilometers away. Hospital was in Charminar. Now the hospital Charminar shifted to our own building, that the college building. They now, constructed Ayurveda Hospital.
So the Reddy, please clarify, because you raised this word, Charminar Hospital. So there is a Unani hospital there, which is the general hospital.
Yes, sir.
Nizamiya General Hospital.
Jamia TB
And
Hospital.
that is, and then the separate hospital for Ayurveda, which is now moved, which has moved
Yes,
to the
sir.
campus in
Campus.
I have just taken, Pavanji, I have taken the liberty of sending this message to our good friend in Srikanth Perugu.
Telugu. He is now principal of our college.
That's right. So I've just sent this message to Srikanthji to see if he will join us, just to say a few words, because it's a very, very important opportunity to get people like yourself coming together. So there we are, Srikanthji. I hope he will join. Sridhar Reddyji, you have touched on, once again, that aspect of mentoring is very important, you know? And also this apprenticeship to learn this skill. There are many aspects that you can learn only when you are with a senior teacher.
Yes, sir.
And that is the way many aspects of this knowledge gets transmitted. That's the parampara. And you have given us a very swift, but a very interesting introduction to that rich parampara that is there in Telangana. Thank you, Ji. Thank you, Sridhar Reddyji. Please stay with us, because we have previously touched on the Rajasthan parampara, we have touched on the Gujarat parampara, we have touched on the Maharashtra parampara, and we are delighted today that we are hearing a little more about the Telangana, Andhra parampara, and we can sense the pride in all of you of something that is there. So, Sridhar Reddyji, thank you so much. I leave the same question that I have left with Sridharji for the discussion section. How to connect?
Yes, sir. I will provide, sir.
With the developments in Jamnagar, you know, how to present ourselves in a correct way, in a forceful way, in a confident way, the richness of the Telangana, Andhra parampara, so that it connects with the developments being shaped in Jamnagar for the global traditional medicine center.
Yes.
Please stay with us. I know you are busy. I know you are there, but please stay with us when we come to the discussion.
I'm missing a lot. I'm missing a lot because of all the paramparas. Because I'm missing also your webinars daily because of busy schedule, sir.
That's
Today
fine.
maybe because of Telangana Day, especially. In between I came and it was busy, sir. Anyways, thank you, sir. Thank you very much for giving opportunity. I will be.
Professor Reddy, namaskar.
Namaskar, sir. Kaise ho, sir?
ठीक है. You see the miracle. The moment you quoted the Vastu Guru Deepika, how fast Dr. Madanji took out that reference with a blink of lid.
That is
with a blink of lid. How fast it is! Really, his career is beyond imagination.
I never expected.
Congratulations to you. Though you are in Karnataka, Mysore, but congratulations to you on your Telangana Foundation Day.
Yes,
and you could have remained here in Telangana, or you would have flourished much more for the establishment of Telangana Vaidya Parampara. As you quoted a lot, you mentioned each and every subject and department, and we visited as a visitation your BKRK college and along with the Telangana hospital. In those days, it was there. Now it has, I think it has shifted to the main building.
To our own building, sir. That's Yaragada, near to ES Hospital. Excellent. We had good teachers and exposure was there. And
very good. PG section, UG section, different. They were having different HODs also. We visited. It was now it's a wonderful, well-established hospital.
That's I never seen, even in Trivandrum also I didn't find that PG HOD, UG HOD. But those days we had a PG HOD and UG HOD.
I noted down all that in a visitation means report that they have got separate HODs of PG section and UG section, because it is usually a struggle in our college also and everywhere. Whosoever is the PG HOD, why will not be UG HOD? But he is there. There is a good parampara in your
yes,
college.
Sir. We had that opportunity to have a 2 HODs.
You are an alumni of that BKRK, so it's a pleasure.
1888 to 94. After that, I appeared exam for BHU. I didn't get BHU. Then I got Kerala. Otherwise, I would have done PG in Hyderabad only. That was the next.
So you are 94 graduate.
94 graduate.
Wow. I am 78.
94 graduate, sir. 95
Wow.
to 98 PG from Trivandrum.
Okay, okay. Thank you. Thank you.
Thank you, sir. कैसे हो सर, सब ठीक है? ठीक है, sir.
ठीक है, okay, all best.
Sudhakar Reddy ji,
Thank you very
before
much.
you go off and before I give the floor back to Pavanji, this Deepika, that one word, in Maharashtra, in Pune, in Mama Gokhale's book is there. Again, the same problem. It is all in Marathi. It's called Chikitsa Pradeep is another book, which in the local language. Somehow we need to revisit these books. I'm sure there are many such documents, particularly going into Kerala. There is Sahasra Yogam, which is all for local formulations, local plants. Somehow all this must be captured somewhere. And I'm so happy that you mentioned Vastuguna Deepika today.
Yes, sir. Basavaraji already they translated in English. It's available by Chokamba people also, other people also. Only Vastuguna will not touch it till now. But as Dr. Srikanth Perugu sir can, because colloquial language and other things, but he is busy in with principal post and other things, so not possible. I will try, sir, my level best. Thank you, sir. Thank you very much.
Thank you. Please stay with us because we
sir.
want you in the discussion section too. Thank you.
Okay.
Pavanji, namaskar ji. I think, Pavanji, please unmute.
I would like to welcome Jagadishwar ji. You have rejoined Jagadishwar ji.
Domaji Pranam, thank you for being with us today. And we are
welcome
additionally
Rajan
fortunate.
Patankar ji and Dr. Kamlesh Kumar Dwivedi ji from Varanasi. Welcome, Doctor. Welcome.
Kamlesh ji Pranam. We are very fortunate today in many ways. Most of all, we can see Domaji's face. We have had so many webinars where we only hear his voice.
Yes,
but
sir.
for the
Yes,
first
sir.
time. So Domaji, thank you for being with us today. And we look forward to learning a little more. We know that you are passionate about, I can understand today from what you have said, your passion for health of the people in the villages and the rural poor. And we always say poor people deserve better than poor things. And I think this is what you have given us today, the message. And you have reinforced that message by describing the state of the village that you were born in. And what is the solution? Health is one aspect. Employment, skills, what Pavanji is trying to bring is another aspect. Skill development, wealth creation. These are all big challenges. And they're not easy to tackle. They are beyond the realms of politics. Only people can make a change. And people like yourselves are very important for this because you keep reminding us about this, about that need. So we look forward to learning from you. Thank you for inspiring so many people to join today on this special day and providing the leadership here, not only for the day, but also for all of us here. Namaskar ji. Domaji, the floor is all yours. We look forward to hearing from you. I know you are very economical with your words, but today the floor is yours, and we will listen patiently to everything you have to say.
मदन जी
नमस्कार
नमस्कार
जी।
मेरा विनम्र प्रणाम सबके लिए और दादाजी के लिए तो एकदम स्पेशल हाइब्रिडाइजेशन नमस्कार होता है दादाजी माने मैं ऑलवेज जो है ना पवन जी को दादाजी बोलता हूँ because he is putting up in Bengal and usually every male will be called in Ananda Marga system of way of life Dada, whether the male may be younger than or older than. And the same thing for the female used to say Didi. That's all, no other words. These two are used. That is why frequently I used to call Pavanji as Dadaji. This may, I think, have given a little clarification of my call. And before going to the discussion, and you will visualize the Vastuguna Deepika what Sudhakar has referred in his and publication. It is in 1989, costing 145 rupees. I think, is it visible, Madanji?
Thoda, sir, we can see it. Yes. but we can, yes, we can see it. See. Now this was,
Vastugana Deepika.
Domaji, this was published in Hyderabad, this 1989 edition.
No. It is 1989. The publication is ABS Publishers, Rajamandri.
Rajamandri, thank you.
Rajamandri, where Sripada Krishnamurti was putting up. Sripada
you.
Krishnamurti Shastri was putting up. His
Thank you.
homeland is Rajamandri, and now the old people, they have lot of agricultural land in Dhavaleshwaram. His grandson, Sripada Krishna, his name is Sripada Krishna. He is the only grandson surviving at present from Sripada Krishnamurti Shastri. Because he is in contact with me. That's why I am giving reference of Sripada Krishnamurti's family. Only that boy is surviving. What I am coming to know, he is also BAMS from Warangal, Anantalakshmi Ayurvedic College, Warangal, where my baby also studied, but she has her BAMS from Vagdevi. It is a private institution. Warangal Anantalakshmi College is government, and this Vagdevi is a private college.
Domaji, please tell us a little bit more about the importance of this Vastuguna Deepika and how the information is arranged inside and why it is also of contemporary relevance. You know, it's a big book. It is about, I think, 1,500, 1,200 pages almost, you know, and it deals with many aspects of Ayurvedic procedures and material. Please tell us if you could spare a few words just to tell us about
1,144 pages are there in this. 43 pages are printed matter in this Vastuguna Deepika. 1,143, and especially this Vastuguna Deepika, whosoever much adherent to the system of Ayurveda perfectly, then they will tax their brain to Vastuguna Deepika first in common knowledge, what I observed. And in this, like Indian Materia Medica,
we have lost, Domaji, we have lost your voice. Domaji, namaskar. Please unmute. Domaji, आपका आवाज कट गया.
is it audible?
No, thank you. Thank you.
Paranji, is it audible?
Thank you. Yes, we can hear you now. Thank you.
Here,
there is also another question here. Domaji, also another related question. Please tell us a little more about related documents, you know, in the local language, in Telugu, which we would like to know a little more about, you know, like that is referred routinely by local Vaidyas.
Now I have shown you this Vastuguna Deepika. Actually, it is being improved, I think, 2-3 times. It is from integrated state of Andhra Pradesh. And local Telangana texts are being considered. Then Basavarajyam comes first, Basavarajyam. Because Basavaraju was of Telangana, not from Andhra. Like that. Anubhava Chikitsa Darpanam. I think that Anubhava Chikitsa Darpanam, out of them, all the recipes, that means a formula, I think I heard from government side that they are being banned. Though, but the different preparations, out of them, one called Saviraminam. It is an arsenic, Saviram. That Saviram arsenic is only one medicine prepared out of saviram. And they are giving for many people in many diseases, because the procedure is also like that, and these people practice also was there. But if that is being brought to the notice of our students of today, or teaching faculty also today, a deadly, we think that a deadly and dangerous poison is used in a rampant way. How could it be possible? But how they are people in village side, freely they are distributing. There is no reaction at all, and no notice of such incidents. Such preparations are there. Out of them, one, I say that it is totally banned from forest department. That Urabichukaleham. Urabichukaleham means birds, pigeons. Those will be killed, and out of that fresh meat of the Urabichka, that is a pigeon, and they prepare a lehyam called Urabichukaleham. It is also from Anubhav Chikitsa Darpanam. And that is very, people are eager to purchase, but it is being banned by Forest Act. That is why I used to scold them, people who come from Andhra area, usually putting a bag on the shoulder and telling the village people are ignorant people that we prepare Urapichikalayam. It is a, I think that aphrodisiac, totally aphrodisiac, but should not be given to all. Even the qualified section also, who are approached by the patients in this way, when they think blank of their knowledge.
Apologies for the technical error. We have lost Domaji once again. Domaji, namaskar. Domaji, we have lost your. Maybe Pavanji can also mute Sudhakar.
Jagadishwar ji.
Oh, Sudhakar, sorry, Domaji has, we dropped off completely. Anyway, Domaji has started by telling us about the Anubhava Chikitsa Darpanam. These are in fact, Sridhar ji, these are the kind of, this is where when we talk about the traditional medicines, you know, these are the traditional medicines. Now, these are based on Anubhava Chikitsa, Anubhava. So our experience, that is how we have used it. Many of our classical formulations fit into that group. Triphala, Trikatu, or any of those things. It is through Anubhava Chikitsa that, and so our criteria that we are suggesting is outcome measurements. And we are saying, so Sridharji, when you go into some of these areas, those words are understood differently by different people. The people understand this differently, and some sensitivities are there. And I think we must give a little space for people to express those sensitivities. You know, some people don't like to. There are a lot of messages I have seen recently where the Ayurvedic fraternity doesn't like Ayurveda to be called a traditional science, yes, which is what you have highlighted today. But within Ayurveda and within that whole body of knowledge is also some procedures, some systems which are more for the traditional, fit more into the traditional side. We have never done randomized controlled trials. We have never done molecular markers. We just know it is used, it gives an outcome, and this is how it is. Domaji, welcome back. Thank you.
Hello, am I audible, Madanji?
Hanji, we can hear you. Thank you, Ji, for coming back. We lost you in between. You were telling us a little bit about the Anubhava Chikitsa Deepika.
Darpanam.
Darpanam.
Anubhava Chikitsa Darpanam
Anubhava
by
Chikitsa.
Lokaraj Munnaya. Those preparations, I think they are banned. I do not know officially what it is and what the stand is. I do not know. But out of them only, one Savira Mainam, it is an arsenic preparation, and nearby headquarter Mahabunagar, a place like Kalmakallu.
Sir,
It's
kindly sit on one place. Internet connection is being disturbed.
Oh, I see. At Kalmakallu, washerman community is there. They used to distribute this Saviramanam to all the, that means maximum diseases, because such reference is there, because I didn't take much interest to go into Anubhav Chikitsa Darpanam because it was being banned officially. And whereas this Anubhav leaving aside, our Basavarajyam, out of Basavarajyam, I show you little difference that Vataka junction prepared from out of the Basavarajyam formula, it includes Nakswamika. But whereas Bhaishyaja Ratnavali Yoga, it does not include Nakswamika, Vishatinduka. This is the difference. That is why wherever we select, I used to select Basavarajyam's only Vataka junction. And usually I use in my practice from IMCOP's preparation. That will be handmade, not machine made, or tablet form. There are also two categories are available, and handmade preparation only I used to purchase. Like that, the text differentiation, which is showing, and usefulness will be in that context. Likely, I think we immediately jump to medicinal side, but a little bit formation of Telangana. At outset, I'm giving little information about this. Actually, Telangana was a state after Nizam's rule, after independence. Telangana state was it itself as an independent state. But whereas the Andhra, it was with Tamil Nadu, Madras presidency, and when Tamils have, that means did not admit Andhras, then Andhras being thrown out of Tamil Nadu. Then Andhra was separated from Tamil Nadu, and the first chief minister of Telangana was Burgula Ramakrishna Rao only, but whereas the Andhra chief minister was Tanguturi Prakasham Pantulu, the first chief minister, and the capital was Kurnool. And later on in 1956, these people have come to agree, and then it has become as an integrated state, forming Andhra Pradesh. And they have accepted Burgula Ramakrishna Rao will be the chief minister, and that was the Congress party's all politics. It mixed up. But whereas in literary side, the Telangana literacy was very poor since it was Nizam's rule. And the Andhras were right from then onwards being the with the coincidence of Tamil culture and all those things, they were much literated than Telangana people. And when this occasion took place and state of Andhra Pradesh formed, and many more advantages have been taken and utilized by Andhras. And that continued till the 1969 Telangana movement. And this emergence of formation is not the first one. Actually, the demand continued up to 1969, the great struggle for Telangana movement. And previous to that, even in the in the olden days of Nizam state, there was socialist movement, and it was also Telangana movement. led by Kaloji Narayan Rao, who has been taken and whose murtis are, whose that means long murtis are kept now in agriculture college and all those things by today's CM, Kaloji Narayan Rao. And about Kaloji also, I give little reference. On one occasion, I was being represented forcibly to address the demand for Telangana separation on a platform in 1985, which was my marriage year. And forcefully, I was bound to address that demand and that stage where I was not willing to address, but the people who have assembled a large gathering, they forced me to address. But when I got up to the stage, then simply I explained, see, I don't want to become you confused. I explained something from history side and taking into consideration
Pavanji, we have lost Domaji again somewhere.
सर, महाराष्ट्र में एक परंपरा है, आदरणीय पटनकर साहब गाइड करेंगे। एक ढोली बुआ होते हैं, तो ढोली बुआ कभी भी एक जगह बैठ के वो कथा नहीं करते, वो मूविंग में कथा करते हैं हमेशा। उनके पास एक ढोल रहता है, जैसे बंगाल में एकतारा रहता है। बंगाल के एकतारा वाले जितने बाबुल खान वाले हैं, वो कभी भी बैठ के कहानी नहीं कहेंगे, कह के कहानी कहेंगे। तो जगदीश्वर की जी भी ये स्टाइल बड़ी अच्छी लगी मुझे। वो चलते चलते बात करते हैं, वो रुक के बात नहीं करते।
Usually that sort of attitude expresses their what we call this their commitment, like when we are serious about an activity, we usually move on. Even when we were students, when exams are ahead, we used to read almost 16 hours a day, and we never used to sit. We used to hear from one side to another and one side to another. This is a general attitude that we come across in Andhra and Telangana side. When we are concentrating on something, we usually put ourselves on motion.
Thank you, Sridhar ji. Thank you for elaborating. This is very, very valuable. Because we were saying the internet connection is getting lost because...
Sir, I just wanted to tell you that what you were referring to, where the people get, angry when we say, some of the people, that when we say Ayurveda is not a traditional medicine, it is a professional medicine or something. And you were quoting that as he was saying some sparrows lehya, Ura Pichuka lehya, what Jagadishwar sir was saying, Anubhava Pradipika. It's the avalehya prepared out of the flesh of sparrows, the little sparrows that we come across. So that is very famous in Hyderabad and Telangana, Andhra, where particularly these Unani people, they prefer that as an aphrodisiac and rejuvenator. So these are all the things. Vastuguna Pradipika is also such text. I mean, it's a compilation where people who are interested in Vaidya, medicine and all, and gone through different literatures of Ayurveda and all, they try to put the information under one book, which has compiled information and put in a sequence in an alphabetical manner. So what I was trying to tell is that when I said it is not a traditional medicine, I was not referring to such books. Okay. It's only an outcome of, a very distant offshoots of our science. When we say something on a professional ground, professional platform, we mean to say the logical aspects of the science. It could be, offshoots can be many. So like as you were saying, the many of the Rasaushadis and the Trifaladis and all, they are not, they appears to be traditionally prepared, but we come across all those preparations in Samhitas, and Acharya clearly says that these are all only simple, some of the examples I am giving you, not all. So we cannot categorize such medication under traditional preparations, but it is a professional preparation because they have a professional logical integrity behind their therapeutic effects. So where I was talking about that professional word, and where the people usually take the.
Thank you for elaborating. This is very important because most times when these things are being discussed, people come with fixed ideas.
That's what.
And they don't come with the open mind. They don't want to listen. So I'm just putting this here in this platform so that we have enough time here for people to elaborate on this. You know, anything to do with our traditional systems. We hurriedly use the phrase traditional sciences here, and I use this, I want to add a little more here. Here in the United Kingdom, in London, in the Parliament, we have a all-party parliamentary group for Indian traditional sciences. Now, this has all of those sciences, Jyotish, Vastu, and Gandharva. These are all aspects of those sciences. And within that, we are also talking about uncodified knowledge. So maybe this lehium that we are talking about is found only in that local text. And the reason for that might be because it was easy to obtain those animals, those birds. The local population was such that we could use it in large amounts. And there was some experimentation already that went on before it could be documented in a book. I'm raising this because the new center that is coming up in Jamnagar is called the Global Center for Traditional Medicine. And it will attract people from many corners of the world who will be coming to it with different perspectives about this term called traditional medicine. And whoever is there in this institution, and all of us too, we must have clarity in our mind about what we mean by traditional medicine. When we say traditional medicine, we are talking about a system that has come out of the deepest of tattvas and the darshanas, axiomatic foundations that are there. And we must start to rehearse our position and our understanding, because there is a big activity that is landing in India, in Jamnagar. And we must be able to share our thinking with them and also get some feedback from them saying, how are you understanding? You are now the WHO, World Health Organization's Global Center for Traditional Medicine. How do you understand this phrase, traditional medicine, versus how we would like it to be seen as a professional science? For instance, we should work through all those possibilities, and hence the reason why I raised this. I can see Domaji, we will come back to this point, Sridharji. Thank you for adding this, elaborating. It's a point that needs a lot of opening and discussion so that everybody is clear. Tomorrow we might have somebody coming to Jamnagar from Congo, for instance, or from Malawi, or from Zimbabwe, or from Colombia, or Ecuador, Botswana, we don't know. And what is it that we are going to tell them as the basis for this name called the Global Center for Traditional Medicine? What are the different perspectives on that one phrase, traditional medicine? And this leads to a question both for yourself, Sridharji, and also for Domaji, who's back with us. We are talking today about the Telangana Parampara, and Domaji has correctly said how there were two states that came out of old Madras state and Hyderabad, the princely state of Hyderabad, and how they formed the two states and how they were integrated for whatever reason. But the question now is that you have a wealth of knowledge there in textbooks written in local vernacular language, is there a centralized resource for these documents? Do we have it somewhere? Maybe Domaji has an answer to this also. And how do we protect this collections if they are there? Where are they? How are they being protected? How are we going to preserve it for the future? Very important. It is very clear that that part of India has a very long tradition and history of sciences, from the time of Nagarjuna and before. But how are we capturing that 2,000, 3,000 years of history, and scholarship and knowledge? And who is doing this? I put this in Hyderabad. There is the Institute for Medical History in Hyderabad, and Hyderabad has also got several ICMR institutions which were brought there for a reason, And how do we prepare for this future that the world is looking to India for? I leave it there. Domaji, thank you for joining us back. We lost you in between while you were discussing many things. Welcome back.
As far as the literature is concerned about the medicine of Ayurveda, Rajahmundry is the center for publications of the medicinal and at the same time even philosophical also. Rajahmundry is the center of publications in Telugu literature, what I observe to my knowledge. And we get most of the publications from there only. And when this was the emergence, the demand of Telangana was at the peak in 1985 only. In that convention, where the convener was the ex-chairman of Telugu Bhasha Sangam, he convened a meeting when he was being dislodged by the then CM N.T. Ramarao to the incumbency. He brought a cine poet. His name is C. Narayan Reddy. He also comes from Telangana area only, and he was being made as Adhikara Bhasha Sangam Adhyakshudu at that time. This became an irritation to Vande Mataram Ramchandra Rao, and he convened a meeting. And in that meeting, the demand was such, leave that matter to their personalities. There was a lot of criticism against of CM. And where I was present, I couldn't tolerate it. Only the subject should be confined to the demand only, not the criticism of the personalities. It is very hesitational also, I say. And at that time, the subject was that none was pleading for the subject. None were pleading for the subject. Though there was bar representation, and there was so many, all the organizations, that means even government offices also have represented. But the subject was only for criticism of CM and Antras. Why? Why? The demand should be of your, and in what nature it should be. Then when people of my group have forced me to address, then I hesitated because I was not being called from Mahbubnagar. You yourself have come here, come to ask me and to address, because I have come here to give my wedding card, wedding invitation. That is why you are asking me to address. In what way I asked? I hesitated, but they forced, please keep up our dignity by addressing. Then I was forced to the dais. When I took up the subject, only the thing, I have not come here, my words were like this: I have not come here to criticize anybody. This was my first sentence: criticize anybody. But where your demand is, whether Telangana is likely to be, now I give little historical references. Immediately, when I put up my words in this way, that in the First World War, and the chairman got up and he said that, Mr. Jagadishwar, you are turning the pages of history. There are a queue of speakers. That is why you take into consideration. Immediately, I just reversed the style and said to the audience that I'm very sorry, I cannot give my opinion and expression and my point of view approach. Sorry, because there is much of queue for the speakers, I'm getting down. Immediately, the university students have rushed to the platform and asked that, sir, you should not get down from the dais. You have to explain, then we are here to hear you. No, you don't get down. We are here. Then the chairman and the convener, they were dumbfounded. And there was a big hue and cry. And I asked the university students, please don't make such noise because it becomes a nuisance for the meeting also. Go to your seat. Then these people have got silenced. I got to the mic and started that in 1918, the First World War period, France has defeated Germany. And in that war, First World War, when France defeated Germany, and Germany was bound to come to an agreement with the France that the areas which have been occupied by France with that agreement, that made Germany to the extent that when a British historian tours entire Germany, he says that I put 10 pounds in my pocket and hardly I could expend 2 pounds out of it, and 8 pounds remained in my pocket. This was a big instigation to Hitler. And when this was the condition of Germany, and he could not tolerate, though he was army man. He could not tolerate. Hello? Hello? Am I audible?
Please continue. Please continue.
This was it not tolerating subject to Hitler. Immediately saw that my country's condition is such. Then what is the use of survival of Germany? Then he immediately organizes and gets revolted against that the then ruler, and he brings down and he takes reins, and he brings Germany to the extent of 1942, that is Second World War period, that Germany stands first. When he took reins, immediately he attacks France, and and the area which was occupied by France was being freed from France, and it developed like this to the extent of Second World War. What the development of Germany was that not taking his own land, which was being occupied by France, he also occupies extra land of France. And at the First World War period, the long rock was erected in between Germany and France as an agreement, and it was being kicked by Hitler and got brought down. And during his agreement, he stood up and he brought up one another rock, making an agreement between Germany and France. Only the portion which was being occupied by France, Germany was thrown to the economy of that down stature, and when it is being taken, Hitler has developed that. The same thing I questioned. Would you just give me, I'm giving 5 minutes of time, please, the name of that portion, land, which is being grabbed by France, can you, out of all? Then even I just turned my eyes towards the chairs also, who are bulged personalities. Nobody. And immediately the university, Usmania University students ran and just got to their feet. And at that time, Kaloji Narayan Rao was in that meeting, and he is coming to the front chairs just to hear me. Kaloji was there in that meeting, and he was just with a smiling face because he was the leader during Nizam's revolt, here Telangana movement, against Nizam. He was the leader. And he was coming to the front. Then I just myself got a little bit controlled. Kaloji, you are also assembled here. Then I got all the students go to their seats and said that the place which was not to the notice of anybody in this meeting, but it was also being conveyed to me a professor by a professor who comes from Gorakhpur University. His name was history professor of Ananda Marga, and he has given the information, this thing, that that place was named Raur, R-A-U-R, Raur, and which was abundance of, which was having both the things which are useful for industrial development. One was coal and another was iron. These two were there, much deposits in that Raur area. That is why when France has grabbed it, Germany has run down. And when it got back, then Germany has risen up to that extent. This was the thing. Whether immediately I questioned that these two deposits are there in coastal area or in another area of Andhra. These two are only in Telangana. Only in Telangana. Then which area should be developed? How could it be developed? Is it there in the sense of this understanding? And you people are demanding, never you have concentrated that what has been thermal power is established in, that means Vijayawada, but whereas the coal mines are, Singareni coal mines are in Karimnagar district of Telangana. This is the condition of the survival ruling. That is why now you understand. I am not going to instigate that you take a moment and like that. And immediately all the people rushed to me, leaving the continuance of that meeting. And sir, we want to meet you. We want to meet you. Where should we meet? No, I come from Mahbubnagar. It is far away, 100 kilometers from Hyderabad. My company is there and they are officials, government officials. You please meet them, like that. And ours, that was the introduction of Telangana Samaj. Telangana Samaj. That Telangana Samaj first secretary was myself only, and the president was Ramchandra Reddy of Reddy Women's College, who was in charge of Reddy College, Reddy Women's College, which are more popular in Hyderabad. This was the condition of Telangana. Even till to this date also, why Jharkhand is developed to that much extent? Only due to minerals. It was not reverse. Whereas Telangana is totally a mountain area. Much less is agriculture land. My Gurudeva, in his economic theory, progressive utilization theory, he said that where the minerals and mineral deposits are there, which are useful to industries, that will be more rich to develop than the agricultural lands. Because the zenith point is there in agriculture, production, but there is no zenith point in industrial development. There is no zenith point. It is an essential point to be noticed in commerce, economics. That is why even till to this date also, it is not to the notice of brains to the masses, which would have become a big actually revolution if it is being understood by the masses, and would have much developed with the industrial areas in competition. Telangana. This is the outset of this thing. In 1985 or 1969, if you go to the both struggles, where was the position of present ruling CM? Let me know. Even I asked him directly, where were you there in 1968? I was in high school, that means a higher secondary section of multipurpose at that time, and my examinations were held up due to the Telangana movement. And in 1985, actually, when this one movement once again was taken, there was no identity or reference of this personality which is surviving now. It is the fact. And for one another reference also, he was very, very sincere to whom and which has made to put the name of that personality to his son. I think we'll understand the name of the son of this present CM was being named of the founder of a party who represents from Andhra. Likely, if anybody says that I am the only cause and effect and everything for the emergence of Telangana, means I pick up his collar. Where was your identity? And in what moment? And what was your contribution? Let me know. Either by back or by even to the front of economics reference. Come to the debate. They can't. That is why the reference again I am taking the Subhash Bose. I do not beg for independence. I do not beg for independence. Rather, I beg independence from the Britishers for my motherland. I am not a personality to beg morsels. It was his call. That is why he was being called as Netaji. If anybody keeps that, Netaji, Netaji, though do not deserve to be called as Netaji. So many people are there. Now the party's founders are, presidents are being called Netaji. Nonsensical Netaji. Netaji deserved to be. That is why my Gurudeva, though he was maternal uncle, he was nephew, Subhas's nephew, my Gurudeva Anandamurti ji, his mother and Netaji were both brothers and sisters of different brothers. Likely, his problem of the day is that means devoted to the patriots of the patriots, Netaji Subhash Chandra Bose. उन्होंने उनको श्रद्धांजलि दे करके उनके स्मृति पर दिया है. प्रॉब्लम ऑफ द डे जो बुक है उसमें उन्होंने नेताजी सुभाष चंद्र बोस को बोला है द पैट्रियट ऑफ द पैट्रियट्स. Like that. That's why if we come to the comparison of the independence of our land, I say that even to the extent of today's PM also stretches the chest like this and we got that independence. It is nothing but political transformation. It is the political transformation from one complex and to the another complex. But where real independence comes, there should be economic liberation. Then only the independence in right perspective. Okay, ours is not the subject of this side. If we go to this side also, then the national scene also comes and how it could have been and how it is to be and how it is going on. It becomes, and I think that it will not be tasteful to our convener. That's why our subject should be diverted to medicinal side and Ayurveda as
Domaji, thank you. Domaji, thank you for taking us into the depths of this history of the Telangana state. And unfortunately, there were some things in the past. But I want to flag here, if I may, that one point you mentioned about Rajamundry being the home of Telugu publication. And this was what I had talked about. This is in Rajamundry, and this is the Dholeshwaram Barrage. And
yeah. Arthur Cotton's marriage.
The Cotton Museum was constructed on behalf of Cotton in Rajamundry. And look at the statistics look at the vision of this person, Arthur Cotton.
Perfect.
The Dholeshwaram Barrage is 15 feet high and 3.5 kilometers long on the Godavari.
Yes.
Connecting East Godavari and West Godavari. And just that one aspect brought paddy production to this whole area. So there is a reason why some accidents are good accidents, some accidents are unfortunate accidents. And I think we have reached the point today where what we are celebrating today is a very special day, which is a revisit of the strengths of Telangana. And what you have shared with us today and what Sridharji has shared with us today, and we are fortunate to have Sudhakar Reddy ji also here today with us, is that strength of the state of Telangana and how you have brought out a very small aspect of that heritage. So we want to thank you for being with us today, for bringing so many people here to the platform, for pointing us to that history that you are intimately connected with. And that is very important for all of us to learn. But if we come to our topic today and the theme on that parampara, I think, stands on the shoulder of giants. And Sudhakar Reddy ji has highlighted correctly some of those giants from the very, very recent past. And maybe to celebrate what we have today, maybe the correct way would be to not to revisit those strengths, the traditional strengths, going back to the time of Nagarjuna, going back to the time of what this part of the world had in it and what remains to be discovered. And I feel with people like yourselves who are connected so intimately to organizations like the Telangana Samaj, we must open a new chapter. And that new chapter must be to thinking about identifying what is there today in terms of hidden skills, hidden scholars, the hidden knowledge that is there for all of us, and how to prepare this while the rest of India, the west of India, the state, the old traditional state of Jamnagar is celebrating a global event. How can we also become part of that? And we would like to hear a little more about this. Sorry to because our time is precious and we try to use it so that we can take the strength of the past and guide us to go towards the future. And please tell us where we can celebrate the day, celebrate the creation of this revival of this wonderful cultural heritage, and where we can take this for the future. I don't know how to take this forward. Perhaps Domaji, you might have something, or Sudhakar Reddy ji might have something, or Sridhar ji might have something in terms of, I don't know, Sridhar, Sridhar ji, would you like to kind of take us into this discussion? And then we are fortunate that Domaji is here with us, bringing such rich historical and emotional aspects of how this state came about. And I feel there are a lot of strengths there. The point about Rajamundry and the Anicut is just one example of that history that we can use. And before I give the floor to either Sudhirji or Domaji or Sudhakar Reddy ji, I just want to say that on the 12th of May here in London, we have the India-UK Healthcare Summit. And what was exciting there is the understanding from only 500 years ago. It was held at the Royal College of Medicine here. And that is a very young organization, relatively. It's only 500 years old. And in that 500 years, compared to the 2,000, 2,500, 3,000 years of history that we are talking about in terms of Andhra and Telangana and Buddhist culture and traditional medicine, etc. The 500 years is a very tiny part of that bigger time scale. And we have all of that history to somehow revisit, condense, and make it contemporary and make it exciting for our next generation to connect with, and also people from around the world to connect with. The history of medicine is much more clearer for us because we have seen it over a much larger time scale. When we talk about Charaka Samhita, the oldest textbook of medicine, which is extant textbook of medicine, still used as a textbook of medicine. It is not a research publication. It is a textbook, and it has been a textbook for 2,000 plus years. How do we connect this with the strength of Telangana, with the strength of Andhra, that region before all of these newfangled things came out? And where can we take this? Sridharji, in your case, connecting with the Shushruth lineage, the thinking there and their interpretation of this knowledge, how can we connect? How can we bring all this together so that we can become a force in our discussions at the global arena? Thank you.
Yeah. See, I think we need to.
Sridharji, I'm going to interrupt you again. Please, could we, I don't know how to either do that. It is inconvenient for you to hold it in front of you. I was just suggesting if you put it under your collar, then it might be easier. But if you're happy with that, we will listen to you. Thank you.
Yeah. See, first, before we start up anything doing, syncing with some contemporary sciences or anything else, even including a research domain even, what we need to first understand is that we belong to such an age group, era, where there were no other sciences existing, like thousands of years back. And the need of documentation of such knowledge was not really for, for propagation of science, but it's only to make it be available for the next generation. When we see the knowledge documentation today, modern era, it's purely for propagation of knowledge. Of course, it automatically includes the documentation for the next generations. But the pure aim of the documentation of knowledge in a textbook, in the form of textbook or anything else, is totally different from that of our Samhitas period. So naturally, what happens is they had used a lot of techniques to document the knowledge in a condensed manner. And they themselves revealed how to read Samhita to get into the content of the science. See, this is how our science is totally different from that of any modern sciences. So what I was trying to tell is that this needs to be projected properly first. What you read in a text of modern science, could it be a medical science, could it be engineering or anything else, all texts are explanatory texts. They are meant to make the reader readily understandable what they wanted to convey. This is a fundamental point they have in their mind while writing a book. But when you come to the Samhita, this is totally different. They wanted to see that this knowledge is available or made available to the next generations. Whether the generation all would able to read it or understand it, that was not a criteria at all. So therefore, they said that this documentation is meant for the Buddhimatam, not for everyone. It's not for everyone who could read the sentences. There was some strategy they had selected for whom this book would be a book for improving their knowledge. Even Shushruta, at one point of time, he says that who understands, who touches the science, what are the desirable qualities or eligible criteria for an aspirant who wants to understand Ayurveda. He quotes certain qualities, which is not at all taken care of. For example, that shloka I just would like to recite here. Shuchir Guru Paro Dakshaha Tandra Nidra Vivarjitaha Patan Ethena Vidina Shishyaha Shastrantam Apnuyat. Now, Gurupara Shuchi Gurupara Tandra Gurupara Shuchir Guruparo Dakshaha Tandra Nidra Vivarjitaha. Now, these qualities are not at all taken care of for, like any rich science, students of any rich science today. Because the documentation of knowledge in today's sciences are very open-like, they are explanatory-like. But when you come to the science, Samhita, it's all condensed, complex. It's highly studied with different type of obligations. You know that there are Tantra Yuktis, Tantra Doshas. No, see, this is not a quite simple text. What you understand while reading a text, actually the sense what Acharya wanted to convey us is something different from that than that of what we understand actually. Now, this is a logic where we need to understand that it needs to be projected properly. that you cannot take a sentence from Samhita and say that whatever you are understanding is the sense of author. No. But which is quite possible, which is quite correct in terms of in the context of other sciences of modern era. So how we sync this information to the modern sciences or modern contemporary sciences is that first we need to understand, we need to categorize the science in a different platforms, in a different levels, and we should identify standing at which we are talking about what. Then probably we will be able to design certain strategies whereby we can make our content sync with the contemporary sciences. So
Sridharji, thank you. You are so clear in what you have. Thank you so much for highlighting the way, the difference between contemporary textbooks and their purpose to the Samhitas and their purpose. A very, very important point here, and the shloka you have recited is very important. I think Agnihotriji will come back to this one, but I want to invite Professor Sharmaji from Gwalior, because he is also immersed in that space. Sharmaji, Pranamji. If Sharmaji, Pranamji. Because you have very clear, your comment there is really cuts open this whole space so beautifully. Thank you, Sridharji. Thank you so much for presenting it in this very, very, very simple but very easy to understand way about the distinction between the purpose of a Samhita and what we have in contemporary textbooks. And the reason why I say this, Harish Vermaji, who joins us from Toronto most times, he raises this point. He says, if you look at modern medicine today and you look at the number of textbooks that are there and compare it to our sciences, Ayurveda, Siddha, Unani, homeopathy, whatever it is that we Yoga Shastra, our texts are getting briefer and briefer. There is nothing there that is actually helping the student to view the Samhita and its purpose differently. We are not enabling that, and I think that culture needs to come here. Pavanji's whole exercise for having this platform is to think about those issues, about education, about research, about skills, and identifying those needs for the future. That's a skill. The skill of taking one or this karmas from Shushrut Samhita and converting each karma into a textbook. That is the essence of what I think you have conveyed. If you take Panchakarma, each of the karmas is worthy of a whole library of books. The simple concept of Grita or Taila preparations are worthy of hundreds of libraries. A simple karma like Nasya can be elaborated so much into many, many books. And I think this is the point that I am understanding from what you have said so briefly, but very, very beautifully. I'm wondering if Professor Sharma will join us from Gwalior, or Professor Jahasab has unfortunately left us, whether Sudhakar Reddy ji would like to add something to this. This is with a view to putting that energy back into this very special day, Telangana Day, and the scholarship and the unfortunate history and what corrections can be made and where can we do this for the future. Sudhakar Reddy ji, namaskar. I'm also happy to have Momita ji with us. Momita ji, namaskar. Sudhakar Reddy ji, namaskar. Namaskar.
Sir, I will come back within 5 minutes, sir.
Thank you. Thank you. We will wait for you. Namaskar ji. Domaji, I don't know if you would like to add whether I have understood your emotions correctly and whether I have understood what Sridharji offered us today and how we can actually bring all of this, the best of the thousands of years of history and knowledge and scholarship and the unfortunate recent history and this reorganization that's going on, and how to become aware of those issues, particularly the strengths, and prepare it to connect it and make it easy for the world.
But actually,
particularly the young students, Sridharji. You know, when you look at your classroom and you have so many students there, I'm sure there are some students who are better qualified to be writers of textbooks. They might not be very good as a clinician, but they might have that ability to bring a lot of information together. They might have that vasana. They might have a vasana for looking at the old textbooks. They might have the patience to look at some of the wonderful books that Domaji mentioned. That might be their real vasana. They are in Ayurveda, but you have to study your students, and somewhere there will be somebody who says, you know, because that is how all of the textbooks came about, all the samhitas came about by the scholarship of people who were specialists, who had a natural vasana. Pavanji has projected here. We'll come back to this question about how to fire up the next generation, you know, how to fire up the students and to identify, for them to identify what is their passion, what is their strength. Our 386th webinar, which will be tomorrow, the 3rd of June, Friday, 3rd of June, is up on the screen here. The title is Opium Miracle, Medical Miracle. And this is related to a special day, Opium Suppression Movement Day. And we are fortunate to have 4 panelists with us. Professor Anurag Singh Ji from Varanasi, Professor of Swaripka at the Central Institute for Higher Tibetan Studies. We have earlier had some presentations on Buddhist Day, on about some of the richness in the Buddhist texts. Kuldeep Pandeyji, also from Varanasi, from VHU. Earlier talked very, very eloquently in one of our earlier presentations. And Bhupesh Patel ji joining us from Jamnagar Department of Dravya Guna. And finally, Satyapal Sharma ji, who's joining us from interesting Department of Dravya Guna, Global College of Ayurvedic Medical Sciences and Research Center in Saharanpur. So Pavanji, thank you so much once again for bringing so many wonderful people to our platform for tomorrow's event. Now we go back
in my opinion,
please.
Government has limited, means banned, moreover we can say, and manufacturers are not preparing medicine from Vijaya, means Siddhi Bhang, or opium, means Ifen. Now it is very limited. It is limited to very few products like Kamini Vidravan Ras to extend, to stop premature ejaculation. One product is there, Kamini Vidravan Ras, which contain opium, Ifen. And another product was Karpur Ras, that is out of market now. And no other general products are being used from this Ifen or Vijaya. Recently, we have observed within 2 years, various hemp companies are in market. That Vijaya has converted, yoga is yoga and Vijaya is now hemp. So hemp medicine, range of hemp medicine, and means some approximately 10 to 15 companies are available at present in India, which are manufacturing hemp products. And doctors are happy because doctors can prescribe them legally. Government has allowed legally hemp, but it is not being used in Ayurveda. It is very questionable situation. Like this, Ifen, every palliative care, every cancer care in the last stage contains opium derivatives. Maybe morphine, maybe other opium derivative, but those lives are dependent on opium. If opium is not there, their life will not feel pleasure. That means our Ayush needs these opium also and Vijaya also. When we are using Mahavish, in our Ayurveda, Aconitum ferox, Vatsanab has been called as Mahavish. When we are using that freely, in Tribhuvan Kirtiras, in any fever point, so we are using Mahavish freely, but we are fearing to use Upavish, opium, Vijaya or Upavish, not Mahavish. So this is controversial subject, but I have invited speakers to motivate the society that these are not dangerous only, and these are being used by modern, but unfortunately these are banned in Ayurveda indirectly, because person has to take license, person has to maintain all records completely. So persons are fearing, why should we take license? Government narcotic department will definitely raid on us. So these are questions. So we are desiring to re-establish the medicinal miracle of opium by tomorrow's meet. And day after tomorrow, very special day, sir. Day for, just a sec, sir. Please give me 1 second only.
Pavanji, you are connected with the Manufacturers Association. You're vice president for the. Now, when you raise these points in those discussions, what is the reaction you get?
Everybody was ready, sir.
Okay, thank you.
Everybody was welcoming. 75 manufacturers were there in that hotel, and everybody was welcoming the idea that if situation changes, we are ready to reproduce that again. This is our day after tomorrow's webinar, sir.
Thank you.
Because that is International Day of Innocent Children's Victim of Aggression.
Thank you.
And we are celebrating that. Stop aggression to innocent children. Professor Dr. N.P. Singh from Calcutta and Dr. Neha Garg, MD Kai Chikitsa from Chaudhary Brahma Prakash and graduate from BHU, she will be speaking on the topic.
We have such a wealth of scholarship in different parts of the country, Pavanji, and the Central Ayurveda Research Institute. We need to learn a little more about what is happening there. There are so many institutions in West Bengal.
That I can explain, sir, that she will not be.
So,
Because I am here from last 34 years, what is going on there, that can be understood.
Sudhakar Reddy ji has joined us back. Sudhakar Reddy ji, namaskar ji. Thank you for coming to the floor. The question is about the richness of Telangana. We are celebrating that day, and Domaji has described very eloquently. He has highlighted all those important points in the history of formation of Andhra from Tamil Nadu, from old Madras state, and Andhra Pradesh from old Hyderabad state, the state of Hyderabad, and then how they came together, and then the happenings. And then the point that Domaji said was wherever there are minerals, that is sometimes exploited. And in return, I said that Rajamundry, which is, as Domaji said, is the home for Telugu publications. The point I wanted to touch there is Rajamundry must be projected not just as the home of publications, but also that historic connection. And I put this in the context of the Royal College of Medicine. And I said, India-UK Healthcare Summit was held on the 12th of May here in London. And they were projecting, it was held at the Royal College of Physicians, a 500-year-old institution, and they were projecting that 500-year history. And in that context, we have an even more difficult job in terms of our history going back to 2,500, 3,000 years. How do we bring all this back? Local textbooks are available, local books in local languages available with a lot of information. So Sudhakar Reddy, the question here is, it is a big task. It is a huge task because we are an under-resourced nation. And these kind of activities require a lot of patronage and a lot of resources, otherwise we will remain a stifled activity. So my question to Sridhar ji was that we should maybe start to identify young students who are naturally inclined to become the gatherers of knowledge the elaborators of old texts who can understand the local language, who can bring back that richness and increase the textbooks and scholarship for Ayurveda students. Sudhakar Reddy ji, you are also there in Bangalore, senior academic there. How do we think we can respond to this? I think we have lost Sudhakar Reddy. Sudhakar Reddy ji is here.
Thank you,
And
sir.
we are also Namaskar ji.
Thank you, sir. Am I audible, sir?
We can hear you. Thank you.
Okay, sir. So regarding global traditional center at Jamnagar, how to connect it? So it is
Could I request? Oh, thank you.
so it is. I understood that the center is to bring local traditional knowledge into mainstream, because China had a rich traditional medicine like Ayurveda, like Indian medicine, but they have flourished a lot, and they have made to understand by WHO, by conducting research, by publication, that you can say that evidence-based medicine, either maybe Chinese traditional medicine or acupuncture. It became very famous because of only they conducted research and they made into evidence-based. That's why they convinced WHO. And the same way, we are also having more than that rich knowledge in Ayurveda, in traditional medicine in India. Still, we are not able to provide a evidence-based medicine to become globalization. That means the reason now they are given a good opportunity to us to have center here, so that whatever Ayurveda or other traditional medicines existing in India can bring into mainstream by conducting research and making evidence-based medicine. That way, I can feel that there is a research called literature research, drug research, clinical research, and fundamental research. So first, we have to generate the documentation of literary research and fundamental research. That is most important. So why I'm telling means even now also we are only Ayurvedic fraternity people. We are thinking that Ayurveda is now globalized and we have evidence based, etc. But when we speak to contemporary people, still they are in doubt. They don't believe it. And for example, sir, today in our college we had one conclave on interdisciplinary approach to infertility. This is the second program we are conducting. Last 15 days back, it was neurological disorders, where we invited 7 allopathy doctors and 2 Ayurveda experts from out of our college and some experts in our college. So our department of Aichiks HOD will present their cases, what they treated. Then other people will contribute and they will ask question. Was it evidence-based or any data is generated and how it works, pathophysiology and pharmacology and other things, etc. So there's a gap between the allopathic contemporary people and us. So when we able to convince them, no, I'm not telling that they should be convinced, but it is needed, because when we say globalization, everyone needs some protocols. For this purpose, to bring it evidence-based, we should start from the literature research and also fundamental research and clinical research and drug research. And today we had that discussion. There, the one doctor, gynecologist, raised that, sir, you have so much information regarding Basti Karma, Nasya Karma, and Panchakarma in infertility. But we ask only one question, whether you have any medical legal support and also whether you have any documentation for this purpose. They understood within 1 hour that there's a lot of information is there in Ayurveda. And we explained that the treated cases also. But they came to know that everything is there, but only documentation and medical legal aspect. So to overcome this one, we need a research. For this purpose, we had a good opportunity in a Global Traditional Medicine Research Center at Jamnagar. And from Telangana, whatever we had like Vastuguna Deepika or other Basavarajiyam or local other languages books also, we can make into translation. Then we can add clinical research, whatever associates are preparing, practicing since long period, that also can be brought to notice to the global traditional medicine, so that the people will be knowing that what is going on in Telangana, Andhra Pradesh and a part of the India. I hope the global traditional medicine people, they will give opportunity for every state to contribute what is prevailing in their state and what traditional medicine is available and how we can make a evidence-based medicine. So this part, sir. And especially the young generation, young budding doctors, they need to take responsibility to explore the Ayurveda and to make it update Ayurveda. That's important. So when Ayurvedic graduates are updated their knowledge in scientific way, we can able to convince the people very easily, so that the Ayurveda can go to every part of the world. That may be the main motto of the WHO, because we have rich knowledge of clinical medicine that is to be taken to other countries. We need to have a evidence-based medicine. And today one doctor also mentioned that, see, if you go to UK or Scotland, etc., all these things, they have their own protocols. They have own protocols. That protocol only they will follow. But in India, we have 5,000 years history of Ayurveda, but still we are not having a protocol for each disease. Common protocol, I'm saying, sir, because we have their experiences, their local experiences, and based on the practitioner experience. But common protocol is not available till now for each disease. That has to be conducted. That's what they are asking. Because in each country, they have their own protocol. When protocol is there, it is easy for all the practitioners and other contemporary science also can be understood properly. So to make a common protocol for each and every disease, we need a research. For this purpose, I hope the global traditional medicine will be definitely helpful for us, and we have to contribute them whenever they ask any data. We have to give without any secret, because we have some Ayurvedic doctors. Some may say their experiences. Still there, sir. I think we may be knowing that during Mughal Samrajya or other people, Ayurveda not flourished because of only Gupta Ayurveda. That's called Gupta Ayurveda. In history, it is there, Gupta Ayurveda, because they don't want to reveal it. That way, it was disconnected. Now, when education is there, CCM syllabus is there, the teachers are teaching, where, and also teachers in OPD, they can't write their own medicine without showing that students. That way, it is open secret now. But still, there are some people are there, they have the Gupta Ayurveda. So that open mind, that people should come like a open-minded, and they should explore their knowledge to the young generation, so that it will be flourished Ayurveda. So that's why I can say that this much only I can say, sir. Thank you very much for giving this opportunity.
Mic mute है आपका sir.
Sorry, Ji. Sorry, Ji. Thank you. Sridhar Ji, thank you so much for highlighting those key points that I think you put it very correctly, some sensitive issues that you have raised and how to solve these problems. Protocol is something so that everybody, there is at least a national framework in which we can happen. We have 247 Ayurveda colleges in the country. Agnihotriji, my request here, based on what we have listened to today, is that the Ministry of Ayush, or perhaps the Global Center for Traditional Medicine, must have a liaison office that connects on a daily basis with the 247 Ayurveda colleges across the country, Roj. And that feedback is gathered, whether all the students understand about the center, what are we doing in this center. It cannot be a once a year activity. It has to happen every day. There must be an office sponsored by Ministry of Ayush or CCIM that connects with these 247 colleges on a daily basis, every day. And the college must have a dedicated person who addresses the questions and gives the feedback, Roj. And I think in this way, at least there is some respectability now, to and froing of information. Roj, thoda sa. This is my, listening to Sudhakar Reddy ji, this is the first thought that is coming to my mind, that we cannot say it is a once in 6 month event. No, it is something that must happen every day. Just like how Pavanji is hosting us to come and interact every day, it can be done. And it will bring a certain kind of transparency, understanding, a new way of looking at this problem. I want to see if I think Sharmaji has left us. Momitaji, namaskar. And also some thoughts from Sridharji, if we can have some. Sridharji, namaskar. I hope we are coming closer to some of the issues that you're talking about. You know, what is traditional medicine? Why we should think about it in a different way. Sudhakar Reddy ji has highlighted some very key points here, and how to put that respectability back. Before I give the floor to you, I just want to share one. I just want to share one slide, if I may. This is just to put in the context of the global perspective and what is happening every day in what is happening today, and that scale, the history scale that we talked about. You know, we have 3,000 years of history to take care of, while the Royal College of Physicians has only a much smaller period to look at. So this is what I just talked about. CCIM, Sudhakar Reddy ji was correct in saying that CCIM now has standardized catalogs, standardized curricula, and it is all available. The name of the colleges and all of that information is available there. If we just look a little bit into what is there in the Royal College of Medicine here in London, and this is the museum section, you know, and it is a collection of apothecary jars from the 17th and 18th century. And I want to highlight this one little bit here. You see on the right-hand side here is one bottle that says leeches. This was used here also. But what is interesting is over the 500 years, that has gone out of practice. But we are still using it. In Jamnagar, I have seen the use of this. And you will see many other plants and how they have tried to capture this, this knowledge. Here is one plant that is today known to be a plant that is used traditionally to treat inflammatory conditions. So just a few examples, you know, just to say where we should be kind of thinking and being creative, and how we can inspire our young students to think about this slightly differently. Sridharji, I know you have responsibilities of running a department, but how do we bring this thinking into that department? And we have 247 such departments across the country. You see the challenge here. Sudhakar Reddy ji has correctly said, if we want to take this to the world, we have to think about it slightly differently. Now, you are running a department. You have only 24 hours in a day, and you might be working 16 hours a day already. What can we do to?
Yeah. First of all, I just wanted to bring one important point to your notice, that whenever we think of understanding our science or putting our science to the modern era, we pick up our science at that point, which is not actually a correct one. Where we pick up our science, we pick up on a clinical side. We try to find out some solutions to the existing problems, health problems, or we try to compete with other world through Ayurveda to address certain problems which are health issues across the globe or either in our region. I think this is a wrong step we have been doing, have been placing. We should first, like treatment is the last part of our profession. We need to first understand that our science is totally through and through a different science from that of all other medical sciences. It has given importance to understand body mechanisms, its impact on surroundings, and the surroundings and their impacts on the body mechanisms, and the aim of the life, etc., etc. Science talks much about these aspects, and at the end, of course, it also includes medicinal aspect. But when we see the medicine and the medical fraternity across the globe, our intention is only to compete, prove ourselves that we have enough strength, enough knowledge also in our Ayurveda that can compete with the other sciences, or probably it can address better manner all other issues, medical issues, which are prevailing in one area or other area of the globe. We need to first understand, concentrate on the concepts on which Ayurveda tried to simplify the entire profession. See, the beauty of our Ayurveda is, see, there are only 3 elements which are said to be responsible for all activities in the body, 3 doshas. And see the beauty, there are only 7 elements which support these activities, saptadhatus. When you come across, contrary to this, when you go to contemporary sciences, there are innumerable number of elements. See, they made the science more complex, but our acharyas, they made most complex science into most simplified manner. This is the beauty. See, we left the concepts. We did not mind to understand how acharyas try to calculate, how to enumerate the body mechanisms, using that talent, how to address the issues, how to improve our health profile, global well-being. We altogether changed. We wanted to run parallel to the existing sciences, and we picked up those areas where the other contemporary sciences are working, like issues, medical issues, in health issues. This is a wrong step you have been doing. We should correct that. We should concentrate on conceptual aspects, which is totally different from that of modern science. We need to highlight these concepts after proper understanding on our own. This is one important point. Secondly, as you know, we have to run as the society runs, because for our survival. So we need to take up even the clinical aspects also, but less importance to clinical aspects, more importance to conceptual aspects. This is the point I just wanted to highlight.
Thank you, Sridhar. I think that point. I just want to record this here, highlight the conceptual aspects, and we are very fortunate that Sudhakar Reddy ji is here and Agnihotri ji is here from Swastavrit section. That thinking is there, but somehow Swastavrit is that aspect of Ayurveda which is least appreciated by our students. They all want to become neurosurgeons at the end of this.
Sorry to disturb. Sir, I'm not talking about Swastavritta, sir. Sir,
okay.
I'm not talking about Swastavritta. I'm talking about the philosophy which helps the Ayurveda Vaidya to calculate the pathological issues or a clinical subject and come up with a solution. I'm not talking about Swastavritta anyhow. It has been given much importance in Ayurveda. But even in therapeutical aspects also, there are concepts which simplifies the treatment modalities. That's what our Acharya says, that one medicine can treat many diseases. This is, see how beautiful it is. And this comes only possible when you know the concepts on which the clinical examination is adopted and assessing pathology is adopted, and the planning of a treatment modality is adopted, and selecting of a drug is adopted, dosage of the drug is adopted. There are so many elements which are not concentrating. We are just, reading a sentence from the Samhita and trying to put it in practice and taking a statistical data and producing it in a journals or somewhere else.
Thank you. You are opening up some very subtle points, very important points. And I think all those aspects about Matra and, all those subtle aspects and how it connects with the deeper principles is very, 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 very important. Do you think these skills codifiable, or will they remain soft skills? This is because when we come to the training aspect, one of the mandates of the Global Center is training. And do you think we will be able to convey this subtlety, this, what you have learned? Perhaps you have connected with many Vaidyas and many senior people, and you have this confidence now. But do you think we can impart this to somebody who is going to come from South Africa tomorrow to the Global Center to learn about Ayurveda? Is it something we'll be able to convey?
It's quite possible, sir. We feel it is not possible because again we see the same issue in the background knowledge of modern orientation. That should be changed. See, when we try to understand allopathy science, we learn its basics. Without trying to understand basics of allopathic science, outlook of allopathic science, we cannot think of analyzing anything on modern science. Similarly, if somebody is interested to learn Ayurveda, we cannot blindly invite them and say you assimilate this. We need to tell them that these are all the certain basic things. These are all the elements on which the science has built up, analyzing the different activities of the body, pathological issues, for what we call pharmaceutical activities, and so many other things. Then probably it is quite easy to even come up with some modern tools also to document it, to show it in a physical graph or something else even.
Well, Sridharji, we are very grateful that you are touching on points that are fleeting points most times in discussions. They come, we talk about it very quickly, but now you have given us, you are dwelling on it, you are opening it up very nicely, and thank you so much for this. I'm hoping that in a decade or so, we will see you as Vice Chancellor of the Telangana, of the Health University somewhere in Telangana or Andhra. We expect to see that kind of leadership from you. And before that, if there is a way to get you to Jamnagar to be in that unit, then that will be another thing. That will be wonderful. What you are presenting here is what we need to have. Is the dialogue that needs to happen. So there we are. We are approaching 9 o'clock. Agnihotriji will comment on all these points because he has many decades of teaching experience, interacting with students, with curriculum, and he has studied in established institutions like GHU and connected with other institutions across India. We are coming to our, usually we try and finish the program by about now 9 o'clock. I can see it's 2 minutes to 9. Domaji, I want to thank you for being with us today, for bringing so many wonderful people here. Thank you for introducing Sridharji to us. And he has put,
Madanji,
Domaji,
before
please.
thanking me, we have to congratulate Dr. Sridhar, who has put forth that conceptual first learning. And Nidra Tandra, the learner should leave Nidra Tandra. How can it be? That is why there should be a aspiration to the learner that I have to learn. That is, and one another aspect is this: the base of Ayurveda is based on philosophy. Why? I give the reference of Sushruta. Sushruta has taken first as doshas. The creation itself is entirely with dosha by the influence of trigunas. That is why nirguna is being called in modern terminology non-attributional entity. Non-attributional entity. This is perfectly in the pravachanas of Anandamurti ji. Now, if samadosha, samagnischa, samadhatu malakriya, if all these well can be interpreted and can be understood by modern science and in modern terminology, and today's that means the surviving knowledge, even this faculty, what they are imparting sincerely should be understood by the students. If such Dr. Sridhar's capacity is there, certainly the learner should become a good learner.
Domaji,
at the
please
same
wait
time-
one. I can see Sharmaji has joined us from Gwalior. Sharmaji, namaskar ji, pranam ji. Oh, Sharmaji, namaskar. I wanted to get some feedback from Sharmaji because Sharmaji, pranam ji.
नमस्कार सर, प्रणाम, नमो नमः।
आपसे भी सुनेंगे थोड़ा सा आज की चर्चा के ऊपर।
जी, ऑफ कोर्स सर, ऑफ कोर्स सर।
हमारी बातचीत चल रही थी ये the next generation and some how to take the strength. आज हमारी चर्चा चल रही थी तेलंगाना परंपरा के ऊपर और the scholarship, the knowledge that is उसको आगे कैसे बढ़ाएं।
ओके सर, ये सर अब जहाँ परंपरा की बात है और आज के टॉपिक तेलंगाना परंपरा, ट्रेडिशनल मेडिसिन ऑफ तेलंगाना, जब ये ब्रह्मांड बना उस दैवलोक की एक परंपरा रही सर, और इस इहलोक दैट इज नोन एज पृथ्वी लोक। तो जो दैवलोक की परंपरा में हमारे जो वैद्य थे वो वैद्य हैं ब्रह्मा स्मृता आयुषो वेदा प्रजापतिम रधि गजे तस्सुनिभ्याम इंद्रियभ्याम अहम मया त्वम्।
No audibility.
शर्मा सर आप म्यूट पे है, अनम्यूट कर लीजिए सर। मदन सर आप भी म्यूट में हैं।
Sharma ji, निकल हमारे से। Doma ji, please, very briefly before the floor goes back to Agnihotri ji, just to bring our program to a close. It's 3 minutes past 9. We will hear a few words from you, Doma ji, please. Before, if Sharma ji joins, we will take some comments from Sharma ji too. But I think the comment Sharma ji was making is there were rules of the Devalok and there were rules for us. And this is similar to what Sridhar raised very clearly, that there are many levels of engagement. There are many levels at which we have to understand this. And that spirit is expressed nicely by Sharmaji in terms of Devalog and the differences that we need to appreciate. Sridhar, the reason why I'm emphasizing this point once again, let me phrase this by saying we highlighted an event here in London last month, 12th of May, big event, Royal College of Physicians, India, UK coming together to discuss. And they say, we have heard so much about Ayurveda. And we know that you are doing many things. And we are curious to learn more. And this is Domaji's comment and Sudhagar Reddyji's comment, but where is the evidence? You are saying it is all philosophical. Okay, we understand philosophy. But we also would like to know whether you can treat diabetes, whether you can treat hypertension. Is there something you have? Whether you can treat intervertebral disc prolapse. And you say, yes, we have so many things, but show me the evidence. Come and work with us here. Or take some of our people to work with you in Hyderabad. Can we make that happen? This is where I'm pushing this discussion to. People with osteoarthritis, people with juvenile arthritis, or all these conditions, and you say we treat this. And they are saying, well, maybe you do. How can we learn a little bit about this? So that is where I'm trying to push this in that direction so that we can also make a statement with confidence saying, okay, this is what we have. You can send 20 rheumatologists to us for 6 months and we will show you some things. Is this something we can arrive at?
Madanji, should I give my submission little?
I think I want to, Domaji, if you will excuse, we'll just hear from Sridharji, or if Sridharji wants to think about it, please, Domaji, whichever way. But we want to hear from you before.
The point is, we are in need of expressing ourselves to the modern era. It is true, okay? But it doesn't mean that we want to express ourselves to those who doesn't know anything about us. See, to convey something from one end to another end, the media must be a neutral one, a common one. A platform should be a common platform. They should know the basics of Ayurveda. We should know the basics of allopathy. Then we can interchange. We can make the things move from one end to another end. You cannot bring 10 people, rheumatologists, and let them stay with us and make them realize that, or make them understand that how we are treating. It's not good. It's not possible. But we can make them realize that we are really treating them. Because we will be showing the evidence. They will be analyzing the cases in their own sense. Let them analyze. But we will be treating the cases in our own style. Own style in the sense, in our own professional manner. Style in the sense, manner.
I see. Sridharji, I think this is a very important point, but you are saying, are you saying we can make it happen?
Sir, see, I do not make statements like this, but I just wanted to give one information in this context, that I run my clinic, which by name called AID. AID. Ayurveda.
Could I, Sridharji, please, I request Sharma ji just to mute. Sharma ji, namaskar ji, thoda sa.
सर नमस्कार.
म्यूट शर्मा जी, अगर आपकी माइक्रोफोन थोड़ा म्यूट करें 2 मिनट के लिए, फिर हम सुने जी श्रीधर जी के बाद, फिर उसके बाद आपसे सुने जी. हाँ जी, थैंक यू. Sridhar, all yours.
So I run a clinic by name AID, Ayurveda Clinic for Incurable Diseases. Incurable word is put in inverted commas, but I treat the cases right from common cold to coma only by Ayurvedic medications. See, I'm not claiming that I treat every case, but I am claiming that the capacity of science of Ayurveda is so great. If you could touch the sense of the science, you can do wonders which is not known to modern era. But it doesn't mean that I should try to make modern people understand this. It's their task to learn Ayurveda. It's not my task. But however, since we live in the modern era, it's our responsibility even we need to feel that we should be expressed to the modern era. So we should selectively take the people, make them understand what Ayurveda looks about, Ayurveda bodily functions and all, then make them understand that, then you show them that this is the way how you should treat. Then that could be the possibility. But
Thank
not
you,
that
Sridhar.
somebody...
Yes, I think we get you.
Experts.
Yes. We get, you have, where is this Ayurveda for incurable diseases? Could you put some details here on the chat box now that you've mentioned this? We are curious to hear about this. We can contact you and we can learn more. Sharma ji, आपकी तरफ से थोड़ा सा सुने जी. आप बीच में कट गया जी.
सर.
हाँ जी. नमस्कार जी.
शिवम हरि विधातारम तत्पत्नी तत्सुतान तान गुरु नत्वा समस्त प्रत्युहम शांत मंगलाय च. ये मंगलाचरण के बाद जो मैं अभी कह रहा था, दैवलोकीय परंपरा के बाद पृथ्वी लोक पर आयुर्वेद आया. ये आयुर्वेद के जो हमारे मनीषी रहे, एक बात से शुरू करने के बाद फिर मैं तेलंगाना पर आता हूँ. तेलंगाना पर हमारे यहाँ दिया आचार्य चरक ने, तत्वावबोधानाम हर्षाणाम श्रेष्ठ. तत्वावबोधानाम, हम यदि किसी तत्व का सिद्धांततः ज्ञान रखते हैं तो हमें बड़ा सेटिस्फेक्शन मिलता है. ये हमारा एक वो रहा जो शुरू इनिशियल फेज में जहां अपन अध्ययन अध्यापन शिक्षण की बात कर रहे थे, एजुकेशन क्वालिटी की बात कर रहे थे, वहां पर हमें इस अध्ययन अध्यापन में और हमारे तेलंगाना के सभी साथी महानुभावों को प्रथमतः मैं उनके तेलंगाना दिवस की ढेर सारी शुभकामनाएं देते हुए सभी लोगों को, जिसमें श्रीधर जी, शैलेश सक्सेना जी, जगदीश्वर जी, भानु प्रसाद जी, मदन जी, आपको, विनीत अग्निहोत्री जी, पवन शर्मा जी, ये सभी लोगों का जो एक प्रयास है कि हमें जोनल, हमारी ट्रेडिशनल व्यवस्था में, हमारी लैंग्वेजेस में जो भी बेहतरीन चिकित्सकीय व्यवस्था है, चाहे वो हमारा लिटरली कंट्रीब्यूशन हो, चाहे वो हमारा क्लिनिकल ट्रायल कंट्रीब्यूशन हो, जस्ट लाइक वस्तु गण दीपिका बसवराज्यम अनुभव चिकित्सा प्रदीप, जिस तरह की हमारी लिटरली व्यवस्था है और इस पर जो भी क्लिनिकल ट्रायल हुई है तेलंगाना में, यदि इसको मल्टी लैंग्वेजेस में अपन ट्रांसफर कर हमारे नॉर्थ बेल्ट की सबसे बड़ी ये कह लो चाहे तो ये फेलियर पॉइंट है कि हमारा इंग्लिश बड़ा पुअर रहता है। मैं भी एक बहुत बढ़िया मतलब क्लिनिक रन करता हूँ प्योर आयुर्वेद की सिंस 81। तो सिंगल ड्रग और कंपाउंड पर योगों पर और शास्त्रीय क्लासिकल योगों पर मेरा कुछ अच्छा अनुभव है। चाहे वो मैं एक त्रिफला की बात करूं, त्रिफला का जो दिया है हमारे वैद्यों ने, हमारे मनीषियों ने, हमारे आयुर्वेद त्रिफला कफ पित्त अग्नि कुष्ठ में हरा सरा चक्षुष्या दीपनी विषमज्वर विनाशिनी, ये हमारा त्रिफला कफ पित्त को हरने वाला त्रिफला कफ पित्त अग्नि कुष्ठ, मतलब डर्मा में भी इसके अच्छे पेनिट्रेटिंग रिजल्ट है। कफ कुष्ठ में प्रमेह में भी है, कुष्ठ में हरा और सरा। अब देखिए डायरिया, एक तरफ हम त्रिफला से विरेचन कराते हैं, पेट साफ करते हैं, परंतु यही त्रिफला डायरिया को एंटी डायरियल का भी वर्क करता है। ये वैद्य की परिकल्पना है कि वैद्य उसमें क्या मुलेठी मिलाएगा, वैद्य क्या उसमें होलोरिना एंटी डिसेंट्री का कोटेज मिलाएगा, या हम बिल्व के गूदे के साथ, बिल्व के पानक के साथ इसका प्रयोग करेंगे। तो ये हमारा जो हॉट जोन है, जहां हमारे यहाँ उष्ण गर्मी ज्यादा रहती है, चाहे वो तमिलनाडु हो, कलकत्ता हो, वहां पर हमारे योगों में हमारे स्थानीय वैद्यों की जो व्यवस्थाएं या जो अनुभव है उसको जोड़ते हुए क्लासिकल जो भी हमारे रेफरेंसेस हैं, जो भी योग हैं, उन योगों में हमें अपना निजी अनुभव शेयर करना चाहिए। इसके अलावा जो डॉक्टर जगदीश्वर श्रीधर साहब ने अर्जित के ऊपर हमारे यहाँ फेशियल पैरालिसिस में उन्होंने कुकुटांड और कुकुटांड मुर्गी के अंडे का जो स्वेदन बताया, वह भी और मात्रावस्थी, यह वास्तव में एक अनुभवजन्य और निश्चित सफलतादायक व्यवस्था है। साथ ही तेलंगाना की जो भी WHO ग्लोबल सेंटर के माध्यम से पूरे इंडिया में हम इन सब राज्यों की जो भी कंट्रीब्यूटरी व्यवस्थाएं हैं, कंट्रीब्यूटरी वैद्यकीय अनुभव है, उन सबको शेयर करें और उस प्लेटफॉर्म के माध्यम से अब्रॉड उसको ब्रॉडकास्ट करें। उसमें आपका सेमिनार और आपकी सोसाइटी हमारा सहयोग करेगी, हम इसके लिए कृतार्थ हैं। सभी को साधुवाद देते हैं, सभी को बहुत बहुत धन्यवाद देते हैं। तेलंगाना बंधुओं को सभी को जो उन्होंने हमें ज्ञान और व्यवस्था दी, जो वहाँ की ज्ञान की परंपरा की वैद्यकीय परंपरा का ज्ञान दिया, उसके बारे में जानकारी दी, इसके लिए मैं उन्हें बहुत बहुत साधुवाद देता हूँ। साथ ही मदन जी, आपको ढेर सारी शुभकामनाएं कि आप सबको समायोजित करते हुए, सबको व्यवस्थित करते हुए, सबको थोड़ा थोड़ा समय दे देते हैं, तो हम लोगों के अंदर जो है वो बना रहता है ना कि कुछ बोलना है, कुछ कंट्रीब्यूट, शायद हमारे मुंह से कुछ अच्छी बात निकल जाए जो आयुर्वेद के लिए उपयोगी सिद्ध हो, हमारी विद्या में, हमारी वैद्यकीय व्यवस्था में सहयोग प्रदान करे हमारे आने वाली पीढ़ी को, और ऊपरी पहली व्यवस्था के माध्यम से जो हमको परंपरा में, तो जो ट्रेडिशनल सिस्टम ऑफ इंडियन मेडिसिन है, इसको हमें स्ट्रांग बनाना है बाय द हेल्प ऑफ रिसेंट रिसर्च प्लेटफॉर्म।
चलो जी,
ओके सर, धन्यवाद।
डॉक्टर साहब धन्यवाद। आपने जो हमें धन्यवाद देनी है पवन जी को, आपके मध्य प्रदेश का जो स्टार है यहाँ हमारे साथ, ही इज द वन होल्डिंग अस टुगेदर जी। सो शर्मा जी,
सर
we thank पवन जी for keeping us together, एक फैमिली जैसा, परिवार जैसा जो। तो we are very happy शर्मा जी, आपने जो बताया है कि हर एक देश में कुछ ना कुछ है स्पेशलिटी, अब उसको कैसे ले आए और वहां तक कैसे पहुंचवाए, ये जो बात जो आपने बताया जामनगर तक कैसे पहुंचवाए, ये जो विचार हमारी जो है शायद पहुंचेगा, शायद
अवश्य अवश्य अवश्य,
शायद सुन रहा हुआ लोग बाग, पता नहीं।
नहीं सर, निश्चित।
झा साहब है हमारे साथ, अग्निहोत्री जी है हमारे साथ, शायद पहुंचेगा जामनगर तक हमारी जो।
सॉरी सर, झा साहब को नमन करते हुए, झांसी भी झा साहब रस शास्त्र के बहुत मूर्धन्य विद्वान है सर, बहुत ही मनीषी है, मनीषी आयुर्वेद के रसो वाइद्य।
बिल्कुल बिल्कुल। सो दोमा जी, वी आर कमिंग अप टू, अब 9:15 20 मिनट हो गया, 9 बजकर, शायद we should try and draw this meeting to a close. हमारी पवन जी, हमारी तरफ से I want to thank Sridhar for opening the batting today and for giving us, Sridhar ji, you have touched on very subtle points, choti baat, which is just thin areas you have grossified it, and we are grateful for that. We are grateful for Sudhakar Reddy ji as appearing with us and sharing so much. Sudhakar Reddy ji distilling some points which are our concluding points for our event today, very important points. And Doma ji, thank you for taking us into the depth of the history of this part of the land, the recent history. I touched briefly on the older history, thousands of years ago, Nagarjuna and the Buddhist culture, and the reason why Telangana, Andhra, that region has such a superiority in use of Resaushadis. And thank you for sharing information not only about the earlier book, the Ayurveda text, Basavarajya, etc. We need to start to think about this. And Sharma ji, aapki taraf, we are very grateful. Gwalior se you have joined us today, and we are appreciating your aapke jo feedback is very important for us.
Thank you so much, sir.
Thank you ji, thank you. Rajan ji hai hamare sath. Rajan ji, thank you for joining us from Mumbai. Sridhar
एक मिनट बात कर सकता हूँ?
हाँ जी, प्लीज राजन जी, आपकी तरफ से सुने थोड़ा।
यस। अभी जो शर्मा जी ने कहा वो एकदम ही प्रिसाइज था कि हमारे तरफ से कि उनकी भाषा में नहीं पर हमारी भाषा में उनको सिखाना, जो भी बाहर से लोग आएंगे, और इसके लिए डॉक्यूमेंटेशन, ये जो बात उन्होंने कही कि वो एकदम ही सही है, और ऐसा शायद हो सकता है, ऐसा मुझे भी लगता है जामनगर में, क्योंकि वहाँ भी जो सॉरी टू से जो भी बहुत हमसे भी बड़े लोग जो बैठे हैं तो कितना एक्सेप्ट करेंगे वो, उसमें थोड़ा सा शुरुआत में मेरे ख्याल से क्वेश्चन मार्क रहेगा, बाद में तो
नहीं रहेगा सर। हमें इंटीग्रेटेड भी मिलेगा तभी चलेगा, इंटीग्रेटेड भी मिलेगा तभी चलेगा सर।
हाँ नहीं, इंटीग्रेशन तो चाहिए सर जी, पर वो कैसा है कि वहाँ पे आयुर्वेद को ज्यादा कैसे प्रमोट किया जाएगा, ये मेरे इसमें थोड़ा सा क्वेश्चन मार्क है। ऐसा एक मेरा
राज्यों से सभी स्टेट्स का प्रतिनिधित्व हो सर।
हाँ
सभी स्टेट्स के प्रतिनिधित्व।
हाँ तो ही वो हम लोग क्या बोलते हैं ना कि उसको अगर आगे ले जाएंगे तो ही वो हो जाएगा।
Of course.
Yes.
Rajan ji, thank you so much. Very happy that you are listening to comments कि महाराष्ट्र की परंपरा, we were talking about चिकित्सा प्रदीप और पुणे में रसशाला. There are many strengths there. We have a dialogue between Pune, Rashshala and Telangana Bhasma Ayurveda preparation people. There can be something that is very unique for the whole world. Nobody else in the world can do all these things. Only we can do
Correct,
this.
correct, correct. 100% true.
So I will take, because we are running close to, well past our closing time, I'm going to take this opportunity to thank all our panelists today for this rich discussion. And I particularly thank Sridharji. Sridharji, you are part of the team. Please join us, guide us, bring your young students into the platform, your young staff members into the platform to give presentations, to encourage the growth of this activity. So we are grateful you have joined us today. And finally, हमारी शर्मा जी, हमारी तरफ से एक सजेशन है जी कि यहाँ यूरोप से डॉक्टर लोगों को ले आए हिंदुस्तान, आयुर्वेद सिखाने के लिए नहीं जी, खाना खाने के लिए, कि हमारी आ जाओ मध्य प्रदेश की खाना खाओ और देखो, फिर देखो, if you like our खाना, then you will like our science. खत्म.
Sir, that according to that zone, जिस जोन से आएंगे, जिस स्टेट से आएंगे, जिस राज्य से, जिस देश से आएंगे ना सर, हम मध्य प्रदेश उसी तरह के संस्कारों के साथ भोजन परोसेगा.
बिल्कुल जी. भोजन से, through food we make friends, through friends we make dialogue, through dialogue we understand, and through that understanding we will become curious about this kind of science.
Sir.
So with those few words, I thank everybody and I put the platform back to Pavanji. Pavanji, thank you so much. Exciting, unexpected developments, but we have learned many things today. Thank you, Pavanji.
Thank you very much. Now I would like to request Professor V.K. Agnihotri sir for his valuable concluding remarks. Excellent means mesmerizing and inspiring session was there. Today we have celebrated 6th states Parampara. Now 24 states are left. Welcome. Dr. Agnihotri.
Thank you, Dr. Pawan Sharma ji. Namaskar to all. इससे पहले हम अपना कंक्लूडिंग रिमार्क्स की ABCD शुरू भी करें. 2-3 खास पॉइंट है जो हमारे दिमाग से न कहीं निकल जाए, इसलिए उसको पहले करेंगे. सबसे पहले तो पवन शर्मा जी का इस बात का धन्यवाद कि बड़ा प्रयोगधर्मी है. He has put me at tail. तो हमको टेलेंडर से कई बार जो ओपनिंग पर भी लेने लगे हैं, तो ये सोचते हो टेल पर तो हम 60-70 रन बना देते हैं. Let us take a trial of him as an opener. So, and this is my pleasure that I started sharing the responsibility of Professor Vishnu Vishal Sharma ji on his absence. Second point, which was just seen on today's webinar, that regarding the delivering style of Dr. Jagadishwar Doma ji. Very correctly, he was delivering on walking. And so was the case with my professor, Professor S. Shukla ji. He used to take rounds whenever he starts, even in his residence. He used to ask me that you sit on my sofa and I'll deliver. Sometimes he used to start a bidi for smoking. And he used to say, कि बीड़ी पीते समय concentration बनता है. और then he पता नहीं चलता वो कहाँ जाते थे, फिर वो philosophy चले जाते थे. And third one, which made me more crazy, regarding the Professor Madan Sarji's submission, that in UK, you told that there is all party political parties committee which is searching and talking about the say Jyotish and Vastu and all that. But you stopped here as etc. I became crazy to know whether they are also having some point of discussion on Kautilya Arthashastra of India.
So, we haven't reached. Thank you, Agnihotri ji. Thank you for asking this question. That it is slightly.
I've got one more, but I just let me complete my sentence on Kautilya Arthashastra and again on Vatsyayan Kam Sutra, because what I am inferring, these two things are equally important for our society and for our health. So we can, when we will talking, we started celebrating our Telangana Day with the getting the information regarding the Telangana Vaidya Parampara, and we reached to that station regarding we are more serious and more sincere for the contribution regarding the establishment of the WHO center in Jamnagar for traditional medicine, how we will be able to contribute in the terms of the its scientific approach. Though we are struggling not only for last 75 years as we got independence, we are struggling say 5,000 years back. So it's a different, and what my suggestion is that our contribution or how we can make possible for this center's support, we may have a separate webinar or a series of webinar, especially those who are having plus 60 years of age, because they are having a great experience and their contributions. And again, on other day, youngsters. Then again, senior persons who have not joined on first day. In this way, we can, Dr. Pawan Sharma is hearing all these things. Then only we will be pinpointed to contribute how it can be done. And then the ideas like Dr. Sridhar and our Domaji and other will come, and they will be really practiced. Otherwise, it will be either just like appendix, and we will not see how it will go forward. So that is very, very important. I do hope that that will run in a wonderful manner. Or another thing which you told, that we can report to our centers on daily basis regarding the development. So UG student can't means contribute anything. As far as the PG is concerned, when I was reading, I was there as a student, MD student, we were taught that you cannot publish or you cannot reveal any of your research work or get published till your synopsis or your thesis is complete, because your idea, your synopsis can be taken by any other person if you got sick or anything, and that will be, that credit will go to that person, the other research scholar or the other, even other country person. So there again, there is some sort of say crisis of matter, that how it can be published or before its submission in a form of thesis. Now let you can please let me know that what you were telling something. Yes, please.
Thank you. Agnihotriji, thank you for raising this point on the यहाँ पे the reason for this all-party parliamentary group for Indian traditional sciences, the reason where it came out was because of that at that time there were some discussions going on in herbal medicine, or the discussions were going on, and it was very clear that it must become a political agenda point, otherwise it will not work. And to make it a political agenda point, there is a provision in the UK Parliament called All-Party Parliamentary Group. Just say from all the parties, you bring members of parliament. It doesn't, so there is no political divide here. It can be from any party. Europe may, if we go, there are 10 political parties, consolidated parties in Brussels, and we can bring people from all the parties there into a group that is passionate about one theme. So their interest is this theme, Ayurveda or Indian sciences. And then it is a voluntary organization, so everybody has to find time. So they established one secretariat, just say coordination ho sakta. So they felt that it must be, usme hai ji, hamari MP saab hai chair, Wembley ki taraf se, Sharma ji hai, the chair, he's a senior labor member of parliament, and so he provided the patronage for growing this thing. So शुरुआत तो medicinal plants की तरफ से और पहुंचा हमारी Indian sciences, मगर उसमें अब तक वो, we are not talking too much about the texts and those important documents from political science or from as you said about the Kama Sutra, but these are things that must come into the dialogue, and it is easy to do this क्योंकि अग्निहोत्री जी यहाँ एक है Mayfair में नेहरू सेंटर करके, और नेहरू सेंटर की mandate is that cultural dimension, that little bit of aspect, and we can easily discuss with our High Commissioner, and we can discuss this and make it some event there if we organize. Then the all-party parliamentary group, which is slightly more focused towards some aspects of the specifics of the immediate specifics of health and not the wider determinants of health. But what you are saying is very important, and we can take this up with in our discussion.
Thank you, sir. Thank you. Sir. If it is the case, then even as they are confining to the study of the herbal preparations or herbs related to human health, I do hope that then there may be addition of one more epic, that is Brihat Indrajal, where so many herbs are used for certain solutions of so many difficulties, and also Vasan Kamsud. It is also containing a lot of aphrodisiac and rejuvenating preparation in a form of herbs. So anyway, that was the issue that came in my mind, that if it is if the Jyotish can be taken, again Jyotish is based on the stars movement and all that, then again how the herbs can be correlated. If it is so, it is wonderful. Then we can also add on all these things. Well, now we start our concluding remarks as a formal way. So first of all, before touching our guest speakers' submission, I would like to pay my respect and regards to Professor Madan Thangvelu sir, our Professor C.V. Guruji, Professor C.V. Jha sir, Professor P. Sudhakar Reddy ji, Dr. Jagadishwar Doma ji, our Vaidya Jayesh Thakkar ji, Vaidya Rajan Patankar ji, और Dr. Indrajit Banerjee ji, Professor B.P. Sharma sahab, Dr. Rampal Somani ji, Dr. Momita Sharma ji, Dr. Ramesh Babu ji, as I told you that he was also Dr. C.P. Sharma sahab, and Dr. Shrikant ji, and our Professor K.K. Dwivedi ji from Banarasi. So, and along with our three guest speakers. Well, it was introduced as well the topic of today's subject is concerned, how the Telangana state came into being with all the struggle, which flashed back by Dr. Domaji, that struggle was running since 1969. Though this and to the establishment of this state. Anyway, so that was a great struggle, but the knowledge which has been poured by our very senior and very competent distinguished speakers like Professor N. Sridhar ji, he touched so many things, especially for the concept of the Andhra or Telangana as such, because previously it was united one. So that ball will go either side. May it be in a terms of Andhra Veshaji Ratnavali, how we are going to clear it that it is of Telangana or it is of Andhra. It is belonging basically as to the mother state. With as a Dhanvantari Anugrah was a typical type of word which has been put forward by him. He also talked about the something that Vyadhi Marg or Rog Marg, these all things were taken into consideration, though he is a surgeon, but still the approach in the terms of Ayurvedic concept, especially the principles part, that is very important, and that is a knowledge learning by the students. Especially we are also happy to be a student when these things are in a form of the recapitulation of the knowledge which we left say 1978 or so. And Mantra Shastra is also important. So many things are put forward, and this is what our tether is. The fact is this: how see we are existing before the word protocol came into being. So it is very difficult to make a mismatch or a match in the terms of the things which modern medicines are interested to have. For the greater sake of our re-establishment, we can go to some extent, but it does not mean that we are going literally word by word the translation to make them our things understandable. For that, they have to have knowledge. As Professor Madan sir told that it will not be only study, it will not be only shiksha, it will be padhai, and I think it is overall diksha. When a diksha will be taken from a guru, then only the knowledge like Ayurveda or a Veda will be in position to be achieved by any of the crazy person, any of the studious person. So it's a fact that to understand Ayurvedic knowledge, colleges like Government College BKRK is there. So many colleges are there. We have got 247 colleges. But persons like you will be there. Then only the treasure of knowledge will get its mouth open, or the thing will come in a way that it will be understandable to our students, and then they will carry on to the foreigners also. And this will be a proper way to establish our knowledge in a center like Jamnagar Center, which has been established. We are still remembering it was 1997 when we have got NEMA conference, especially on the topic of the globalization of Ayurveda. In those days, it was a very typical and new word, globalization Ayurveda. And Professor R.S. Singh, Professor J.K. Oja sir, these were there in Ghaziabad, and we, Dr. Joshi, Sunil Joshi were there, and Professor Dr. Harish Kapoor organized this this whole concept. Right from then, we are having, and I would like to have a cover page photograph to and send to Professor Vandan Sarji. Then, if at all it is there in say our archive, he can take out, or we can get some photographs from that that magazine, that souvenir I am having with me. So the contribution given by Dr. Sridhar ji is wonderful. And what happened when I'm unhappy and I'm sorry that I could not hear our Saxena sir, who were due to present his paper, but he was viewing some very historical situation, the Bhaga border, the return this thing. So it's very good that he is there. But when we called our Doma Sarji, he, with no hesitation and with all submissiveness, told that it will be rather better if you call Professor Prabhakar Reddy ji before me, and then this today's webinar's contents will be much more deep and say more practical. And Dr. Professor Sudhakar Reddy did the justice. As he was called, he narrated all the things, accepted the Apisonmai Lanka Name Lakshman Rochte Janmi Janmubhumischa Sargadapi Gariyasi. With that concept, he accepted that the Mahmood Nagar is the place, his birthplace. And right from then, he told that how he got his graduation from your college, BKRK College, and then post-graduation from Kerala, and all that. With all his submission, because he is a one person, very dynamic, totally having commitment and touch with the Ayurvedic concept, Ayurvedic textual concept, and also working repeatedly with the newer projects given by either CCRAS or our NCISM, because as he quoted that fertility point, he called the modern medicine doctors and talked about the basti and all that. That is very, very important. If this will be a, say, sort of communication in a form of the, say, one-day workshop or say 2 days conference, this will revitalize the hidden and undocumented text of our knowledge. And this is the shortest way to make our honesty regarding the texts which are there. And we are going through only Chakrapani Tika or Jalptaru Tika and all that. So we are well versed with our text because we have spent our 25, 30, 35, 38 years. But for the persons, those who are there, or as per our Professor Domaji's concept that when the Europeans will come, when the other person will come, definitely whatever the Rajasthan, whatever the Maharashtra food will be given to them, that is full of having the concept of our Ayurveda. Our Ahar, Nidra Vamchar, under the concept of Ahar, it will be fully cooked with the Ayurvedic concept. And you know, nowadays it is a fashion that Ahar, Ayurveda Ahar is running like anything in so many state capitals and states. So then comes our Domaji's presentation. He, as per his knowledge and philosophy, he really taken us to that era of pre-First War and Second World War, First World War, and overall he narrated that if a right person is there, he can make persons mum. He may be commissioner, he may be DM, or if he is not having the knowledge of that sector, the right person should come forward with the right knowledge. The things will be different. So goes the case with his submission, that how he narrated his that episode that happened. But as far as the work is concerned, we well know that he is getting preparations by his own interest, by his own methodology, with his own ingredients, and then he is practicing pure Ayurvedic practice there. And Professor Reddy ji told that he is also still not believing over the capsulated form of Himalaya Dex and other things, because it depends upon the test and belief how much he is or anybody is having. So for practitioners, it is a must that they, if they come with their formulation, with their preparation, of course, textual one, the results will be 200%. So this then, and then comes the matter of discussion. Our CP Sharma sir, Professor Madan sir ji, repeatedly Professor our Reddy sir, Professor Sridhar sir, Dr. Doma sir, they all made very good discussion and led ourselves to the almost Jamnagar, near to Jamnagar, and also contributed by Dr. Vaidya our Rajan Patankar ji. We will all very crazy, and you see, now this is the responsibility of our Ayurvedic person's shoulders, that now they have come with their bag and baggage, that what is you are containing, what much you have got, tell me, show me, prove me. So it is our duty to make ourselves worthy of Ayurveda with the all terminology and text which we are having, but at the same time, in the terms of scientific approach, though we are too much scientific, and I have got an objection that I am not going to take that Ayurveda is traditional. It was a great, battle in our BHU days also, Professor Rupa sir. And I told so many times that in Erlangga University, Indonesia, Professor LB Guru sir went there and he delivered a lecture that traditional medicine and Ayurveda, way back in 1985. I've got the copy and the translation copy of that. So we have to see, we Ayurvedics are knowing that we are 200% scientific, and they are putting that it is coming in from tradition to tradition, so they can put a level like traditional. But we have to save Ayurveda, irrespective of the terms they are using. It's a scientific paranoma, should be intact, kept intact all the way, and it is a duty bestowed upon our shoulders. So thank you. Our suggestion is that on this topic, separate webinar can be, and senior persons having plus 65 years of age or 30 years of experience will be of great contribution, along with our youngsters of 40, 45 years and up to 50 years. This is what I have to submit here. Thank you so much, and thank you for the opportunity given to me by our webinar organizers. Thank you. Over to Dr. Pawan Sharma.
थैंक यू वेरी मच सर। मैं आप सभी का आभारी हूँ कि आज आप लोगों ने इतनी देर तक बैठ के और बहुत अच्छा डिस्कशन किया। आई एम रियली ग्रेटफुल टू बोथ द स्पीकर्स, रेड्डी साहेब, सीपी शर्मा जी, एंड आवर गार्जियंस मदन सर, अग्निहोत्री सर. How can I express my gratitude? I am unable to understand. But thank you. Good night, sir. Tomorrow we are meeting for opium.
Thank you.
Hariom, sir.
Sridhar
Good night.
ji, thank you. Sharma ji, thank you. Rajan ji, namaskar. Doma ji,
Pranam, sir.
Agnihotra ji,